kancane sizophumelela kancane sekusele kancane kancane sizophumelela sekusele kancane sekusele kancane kancane sizophumelela sekusele kancane sekusele kancane kancane sizophumelela sekusele kancane Ritshidze sekusele kancane kancane sizophumelela sekusele kancane
Mpumalanga, viva! Viva Gert Sibande, viva! Viva community, viva! Viva better healthcare services, viva! Amandla! Sekusele kancane, comrades, let's sit down. Thank you very much. Good morning, everyone. My name is Bongile Chabalala. I'm the National Chairperson of Treatment Action Campaign. I'm also the General Secretary of People Living with the HIV sector. We are here in Mpumalanga to launch the third version report of Mpumalanga. Before I introduce my team, I would like to thank everyone who is in the room with us, from community members, patients, Department of Health, partners, DSPs, media people, people who made this event to be a success, because most of the time it's not easy to organize such events. You might think that it's easy just to place a tent, place everything, but it takes a lot of time, takes a lot of energy. So we often forget those who are working behind the scenes. So before we start, I would like to acknowledge few people who are in the room. Busiso Shozi, who's from District Technical, Paulina Mashane, DDPHC, Hlahudi, I'm saying Chabeleng. Sir, Hunani? Oh, Hunadi. I English, handwriting, yeah, handwriting. Yagatogotela. Hunadi Chabeleng, AOTP, Broadreach, Peggy Koza. We know that we have our coalition partners from PWN, Mapaseka, Mankind. Moikent, hey! As you see, guys, from Treatment Action Campaign, we have Sfiso Nkangala, and then from Napa, we have Vangile Mashinini. Yes, Mashini Nokbokokwam. So, Ngimbiza right. Yeah. So, without wasting any time, colleagues, and I know these engagements, sometimes they take a bit longer because we are telling stories, we listen, there are emotions. Can we all try to bear with us, be patient with ourselves, and try not to be outside most of the time and listen to what is happening, so that we all come up with possible solution and recommendations, and see after all this engagement, how can we make Mpumalanga better? How do we um, upgrade the services, especially now that the NHI bill it's just gone through Parliament. It's just going to go through NCOP. And we know that when we talk about NHI bill, there are still a lot of things that needs to be fixed in our healthcare system so that we can be able to access it, because we believe in universal health coverage. We believe in equal services and treatment, regardless of gender, regardless of race, regardless of nationality. So without wasting any time, colleagues, I'll just outline our programs. Our program will be as I already done the welcoming, and then it will be overview of report and data, and then it will be community priorities and testimonies, which it might take longer because it has subtitles. We'll be talking about staffing and waiting times, art collection and ARVs refills, art continuity, key population, index testing, infrastructure and clinics conditions, TB infection control. And then after that, we'll have partner inputs, as I've indicated that we have partners, which I've acknowledged. And then we'll have reflections from paper district support partners, district Department of Health, and provincial Department of Health if they are here in the room. And then it will be the vote of thanks. So without wasting any time, I will hand over to my colleague. Oh, I forgot to introduce my colleagues on the table. So as I've said, I'm Sibongile Chabalala. Angiyathanda ukulibisa igama lami. And I'm with Simpiwe Kaba, who's the project officer of Mpumalanga. And then we have Lucky Kwebu, who's the district organizer. And then we have James, I don't want to say it wrong. We have James, who's a key populations a researcher. So yeah, this is the team that I'll be working with in the table. Thank you very much. Over to you, SMP.
Ngiyabonga, Chair. Today we have launched the third edition of the Mpumalanga State of Health, developed using data from Ritshidze's community-led monitoring. Ritshidze monitoring takes place on a quarterly basis in 43 facilities across the province. This week, we have held 2 community meetings. Earlier this week in Ehlanzeni, and today we are here in Gert Sibande. In today's meeting, we are deep diving into both the progress and challenges across Gert Sibande, where we monitor 18 facilities in total. We will hear directly from people living with HIV, people who use drugs, sex workers, LGBTQIA+ community members, and other public healthcare users as to the real experiences using clinics in the district. Data are collected through observations as well as interviews with healthcare users, public healthcare users, people living with HIV, key populations, and healthcare providers, being facility managers and pharmacists in facilities. Data in this report were collected between April and May 2023. Interviews took place with 18 facility managers. Observations took place at 18 facilities. Interviews took place with 973 public healthcare users. 52% identified as people living with HIV, and 25% identified as young people under the age of 25 years. Additional data were collected between July and September 2022 among communities of key populations. Interviews took place with 46 gay, bisexual, and other men who have sex with men, 130 people who use drugs, 151 sex workers, and 14 trans people. So we will now move on to our first group of issues, and I will hand over to James.
Good morning, everyone. So the first group of issues are on staffing and waiting times. Improving the state of health services provided at our clinic so that all people living with HIV and key population can access friendly, welcoming, and quality services depends mainly on having enough qualified and committed staff in place. This year, 68% of public healthcare users interviewed reported that there are always enough staff at the facility. This has improved since last year, where only 51% of people said that there were always enough staff, and 47% said there were never enough staff or sometimes enough staff. However, while public healthcare users thought there were less challenges with staffing, only 39% of facility managers reported that there were enough clinical and non-clinical staff to meet demand, down from 55% last year. There is still a way to go to fill the human resource gap, as 61% of facility monitored remain with too few staff to meet demand. Of facilities reporting shortages, 9% of facility managers blamed there not being enough open position on staff shortages, while 27% blamed staff shortages on one or more unfilled vacancies. According to facility managers, the most commonly understaffed cadre were professional nurses, data capturers, and enrolled nurses and doctors. Vacancies in Gert Sibande has dropped since last year from 49 positions to 32 open positions now in the facilities we monitor. The most common vacancies by cadre are data capturers, professional nurses, enrolled nurses, pharmacist assistants, and cleaners. 50% of facility managers we spoke to specifically wanted additional human resource for health support from the PEPFAR district support partner at Broadridge. However, PEPFAR's funding for critical HR posts has only reduced in the recent years. Positively, average waiting times has reduced by just under an hour in the last year in facilities monitored in the district, down to an average of 3 hours 34 minutes waiting in the facility. This includes time before the facility opened, and an average of 3 hours 30 minutes is waiting after the facility opens. However, 4 facilities had waiting times over 3 hours as outlined in the table. However, some public health care users still spend hours in the facility, and this is a major source of dissatisfaction for those who experience the long waits. 66% of public health care users interviewed in the province still think the waiting times at the facilities are long. Although we note that this has reduced since data collected last year, where 75% of public health care users thought the waiting times were long. 54% of public healthcare users blame long waiting times on the fact that it takes too long to find files. Filing systems are messy and files get lost. 30% blames staff shortages, while 30% blame staff not working or working too slowly. In fact, filing systems were observed to be in a good condition in only 33% of sites monitored, just up from 25% last year, mostly due to filing rooms being too small to maintain. Messy and disorganized filing system increased the delays and increased the burden on already overstretched healthcare workers. Positively, the average earliest arrival time has improved from 6:12 a.m. last year to 6:24 a.m. this year. However, some people still begin queuing early in the morning in an attempt to get seen more quickly. 3 facilities still have an average arrival time of before 6 a.m. Of 328 people who arrived before the facility opened, 19% reported feeling unsafe or very unsafe while waiting for the facility to open, just down from 20% last year. While a circular was issued in May 2019 by the National Department of Health calling on all facilities to open by 5 a.m. on weekdays, none of those monitored even opened before 7 a.m. Commonly, facility managers tell us that they are unable to extend opening hours due to insufficient staffing to cover this time. Yet, of 1,063 public healthcare users, 85% think the extended hours would improve access to services. Now we move to our recorded stories.
Mina ngihlala eLeslie ngisebenzisa iclinic yaseLeandra eLeslie. Ama challenges engike ngibe nawo mangiye eclinic nokuthi mangihambise umntwana mhlambe ngiphuma ngo6 masifika siyahlala mhlambe baqale ngo7 bathathe amakhathi wabantwana bahambe bawakhiphe bawashiye lapho bese basilethela amakhathi futhi back bese futhi basifuna ama appointment cards wabo mama uma ngabe mhlambe azange uze nayo leyo appointment card yakho uzohlala baze baqale ngomuntu osemuva wena kudala ufikile number 2 uzuphume mhlambe mawufike ngabo 6 or 5 uzuphume mhlambe clinic ngabo 12 kukhana uphume clinic.
Mina ngihlala eMangosuthu ngiclinic engisebenzisayo iKemville clinic. Into engiphatha kabi laphayana kuleya clinic leya isefasterweni la khishwa khona amafile because manifika kulindwe ngaphandle and then senilindile eside isikhathi mhlawumbe kuphela boma 2 hours 3 hours solondindile and nisayophinde futhi nale ngaphakathi kubanjwe line la masesifakele lamakhadi amancane awukhipha amafile so nakhona kuphinde futhi kuthathe esinye isikhathi eside futhi mhlawumbe uthothi uzolinda i-hour again thola ukuthi solindile futhi sometimes bakutshela ukuthi ifile lakho abaliboni bacela ulinde basazolicinga futhi uthi mase litholile le file uyalibiza igama lakho mhlawumbe uyasuka ufuna usukume uhamba uye khona bese akutshela ukuthi why uthulile awushongani ukuthi ngikhona yena sekufuna ame manje nale file lakho kunzima especially kubantu abadala kufuna umuntu omdala usukuma nini because mase uhlala isikhathi eside vele uyadina yabo leyana emanesini cha i-treatment yakhona i-right bayakhulumiseka mawunenkinga uyakhona ukubuza bayachazelana futhi kahle mabangakhona uku-improve emafayilini ngicabanga ukuthi isimo sakuleya clinic singaba right. Igama lakhe nje angilazi igama lakhe ukuthi ngubani but umfana nje mude nje uyislender angazi uma unayo yini name tag noma kanayo but ngiyayinganaki lezo bengingayinaki lezo zinto urudi kakhulu nje kubantu uyathethisana akanendaba futhi ukuthi umuntu omdala noma ungakanani yabo mhlawumbe u-disable or what akanendaba nje uyakuthethisa akhulume the way afuna ngakhona so azange nje kungiphathe kahle ukuzwa the way akhuluma ngakhona.
Mina ngugogo angizukuzisho kodwa igama ngihlala la eLeslie eItandini ngihamba iclinic yala eLeslie ngithatha amaphilisi ehigh blood. Isikhalo sami ukuthi sihambe ebusuku la mina njengami ngihamba ngabo 5 la ngiye le eclinic nibonile ukuthi nani sekudeni kanjani kodwa ke masifika lapha asizukusizakala siyoze sibuye ngabo 2 3 asinakwa lapha bafike baloku bashona le baphuza amatiye bangenandaba nathi baze baqala umsebenzi ngabo 11 ene thina esifike eqala sibadala sinjalo bayothi abafike emumva kuncedakala bona uma ufaka ikhalo lapha ya kulama box akhona ukuthi uya complain bayayikhipha lezi zinto bayayidabula Uyangibona la mlonyeni njani? Amaphilisi high blood wrong abanginika wona la. Sukela last year nginje bengivuvuka la emlonyeni ngibe nezilonda namabhamuza. Ngaze ngaya kadokotela, udokotela wathi angilethe lamaphilisi engiwaphuzayo azowabona. Ngahamba nawo wafunda lama direction wakhona ngoba vele wayeshilo wathi ngisola ukuthi amaphilisi. Wathola ukuthi lamaphilisi abanginikeze wona wrong yiwo la ngenza so. Dot namanje yabona ngikakapholi kahle. Mangeke usazi sesize siyasaba manje kuye clinic. Ungazi ufe mos khona makuba zange ngiye kadokotela ngize ngiqhunge. Mhlambe ngabe sengingenye into ngamaphilisi aseclinic. Iclinic yethu kodwa efanele ngabe iyasiza ngabe bayanakekela. Kulahleka namafayili lapha. Babudedengu nje ayikho into right abasebenzi ngokuyimisela la kule clinic yethu. Yena abasiphathi kahle thina. Yabona siyathethiswa uma ngabe unesifo esikuvelele uthi ngoba idate yami kusasa ngizohamba kusasa ngiye namhlanje eclinic ngiyothatha lamaphilisi nalapho urong awufuneki idate yakho asiya namhlanje sizogcina ngawe wena nayo nje into engikhala ngayo iclinic yaselesi la ibaphathi kahle abantu ukuthi ngathi ngake kubeke bayilungise ke kulunge lana ngoba abanye abantu baze bayeka ama treatment ngayo le clinic uze umuntu abantu banenge abantu la bahleli bagula basemakhaya uyabona umuntu uqolela ukufaza afele endlini.
Mina ngihlala eMangosuthu ngiclinic engisebenzisayo iKemville clinic. Into engiphatha kabi lapha yana kule clinic leya isefasterweni la khishwa khona amafile because manifika lindwe ngaphandle and then senilindile eside isikhathi mhlawumbe kuphela boma 2 hours 3 hours solondindile and nisayophinde futhi nale ngaphakathi kubanjwe line la masesifakele lamakhadi amancane awukhipha amafile so nakhona kuphinde futhi kuthathe esinye isikhathi eside futhi mhlawumbe uthi uzolinda i-hour again thola ukuthi solindile futhi sometimes bakutshela ukuthi ifile lakho abaliboni bacela ulinde basazolicinga futhi uthi mase litholele file uyalibiza igama lakho mhlawumbe uyasuka ufuna usukume uhamba uye khona bese akutshela ukuthi why uthulile awusho ngani ukuthi ngikhona yena sekufuna manje nale file lakho kunzima especially kubantu abadala ufuna umuntu omdala usukuma nini because mase uhlala isikhathi eside vele uyadina yabo leyana emanesini cha i-treatment yakhona i-right bayakhulumiseka mawunenkinga uyakhona ukubuza bayachazelana futhi kahle maba ngakhona uku-improve emafayilini ngicabanga ukuthi isimo sakuleya clinic singaba right. Igama lakhe nje angilazi igama lakhe ukuthi ngubani but umfana nje mude nje uyislender angazi uma unayo yini nemtech noma kanayo but ngiyayinganaki lezi bengingayinaki lezo zinto lezi urude kakhulu nje kubantu uyathethisana akanendaba futhi ukuthi umuntu omdala noma ungakanani yabo mhlambe u-disable or what akanendaba nje uyakuthethisa akhulume the way afuna ngakhona so azange nje kungiphathe kahle ukuzwa the way akhuluma ngakhona.
Hamba iclinic e4 kodwa kukhona usisters ongangiphathi kahle ongenza ukuthi ngigcine sengidefaultile ngigcine sengasamikisa abantwana eclinic ngesimanga sokuthi uyangijaja mangise clinic ngise roomini ngihleli nabanye abo sister ngikhuluma nabo unokungena makangena afike achazela abo sister ukuthi mina ngumuntu onjani and ngumuntu ozala kanjani iyo inkinga yami engenza ukuthi sicela ukuthi clinic yethu ichinje sibambisaneni nokufika ekseni bese umuntu uzohamba sekubuya nabantwana besikolo ntambama masamba ekseni samba nabantwana besikolo leyo nto leyo ayimphathi kahle.
Mina ngihlala eMbalenhle ngithatha i-treatment yami extension 14 nginale nkinga ukuthi ngiqale i-treatment yema-ARVs 2018 till manje ku-2023 ifile angibi nayo babhale emaphepheni nangifuna ama-results angiwatholi kwamanje nje ukuthi ngimephi angitati solo ngiyachubeka ngiyathatha and angilovi okay ngaba pregnant nangipregnant umntwanami bamcheck-a since namanje angimathi nimntwanami nje ukuthi ufuna achubeka nathe or ufuna achubeke endenjani inkinga yami ngiyo leyo so nginema-number la 2 kwamanje nangipreventa kunenumber yakhona nangapha nakunenumber yakhona angathi ukuthi kahle kahle mina yami ifile number ngiyiphi kahle kahle ngoba ifile angiyitholi lokho kungiphatha kabi ngoba ne-viral load yami angiyadi ukuthi sengigrand or angisigrand solo ngiyadichubekela nje ukuthi kuyogcina njani nini angathi bavele sebachamuka neliphepha lebabhala kulo lelisha and naso ubuyela next time lelo phepha akusasilo sekuphindwe kubhala kulelinye futhi liphepha every April ngiyaveka ukuthatha igazi kodwa ama results angiwatholi ngenxa yala maphepha angathi ukuthi abe seka disappear kanjani kuphi angitati vele namanje elikhadi lokwe prevent anginalo but nalo line file number ngigcine sengiprevente ngaleli khadi without ifile mina eclinic ngivame ukufika vele ngabo ma7 ngibe sengise clinic kubuya kwami ngiyobuya ngabo 12 or 1 so lo ngihlale or futhi nakhona nangibona isikhathi sihamba ngitshela ukuthi or basafuna leli file or njani kanti cha bongichamulela neliphepha kona kungivisa abhlungu ngoba ngiyawanatha lamaphilisi but angitati ukuthi sengikuphi manje sengisesimeni lesinjani ngoba umuntu nemuntu vele nakayithatha i-treatment umuntu utati ukuthi manje sekuhamba njani sikufuna ngitshintshe or ifuna ngende njani or akukho nje lengikwatiko cha umntwana since ngacala kuya naye ngale 3 days nawucetha kuteta bamjova la labathatha khona igazi abazange basanginika naleli results lalo mntwana une follow up yokuthi umntwana unjani kwendekani abazange even ngayenda ne-pap smear khona lapha eclinic bathi bona sobona ngema-SMS uma ngabe sinenkinga siphindze sibuye eclinic but abangitshelanga ukuthi sisi uright or kukhohlweke kubhaleka le-SMS ngoba akukho lesengikuthembako ngoba mina akukho nje kwami lo ngikutholako kahle kahle.
We now move to our community members who have joined us in person today.
Sanibonani ngihamba iclinic yaseMbalenhle ngingaba nenkinga this month early bengigula.
Greetings, I attend Mbalenhle Clinic. I had a problem last month. I was sick.
Bangijikisa
They turned me away.
Ukuthi ngiyagula nginama pain bathi sesawukwazi ukuthi uzositshela ukuthi unama pain la kumele uthenge i-pregnancy test uze nayo.
So I was in pain when I went to the clinic. They told me that I should go back and buy a pregnancy test and come back with a pregnancy test.
Then izange basanginceda kwamele ukuthi ngijike njengoba sengithola abanye bosisi bangitshela njengoba sengidibana nabo sebangitshela ukuthi sina siya report inkinga ezinje then ngaya ke kibo then shuthi babafonela babatshela ukuthi sesiwoza.
So I was not assisted on the day. On my way back home, I met some ladies who I spoke to, and they said, no, I should go back to the clinic. They will speak to the facility manager in the clinic.
Lapho bese ngifuna umphathi wakhona ngathi mina ngizoza kanjani because manje ngisuka lapho ngiyagula. Kumele ngenze njani?
So I explained to them that I'm not feeling well and already I was from the clinic. So what must I do?
Yebo.
Thank you.
Sanibona.
Greetings.
Mina bengihamba eMencindi Clinic.
I'm a patient at Mencindi Clinic.
Bengiyotesta bengisuka esikolweni.
I was from school and I wanted to test.
Yeah, bengigqoke uniform.
I was on my uniform.
Nangifika bangitshela ukuthi ngihambe ngequeueini.
They told me to go and join the queue.
Nangifika like kwafika abantu abasemndenini wabo. Babafaka phambili like kunami because mina dala ngifikile.
I was there before, but as people from their different families, they attended to them before me.
Okay, then after ngafika ngabatshela ukuthi ngizotesta then ngizotestela ne-pregnancy futhi.
When it was my time to consult, I went in and I told the nurse that I wanted to test for HIV and I also wanted to test for pregnancy.
Then ke amanesi aqala khuluma, they became very judgmental ukuthi kwenzeka kanjani ukuthi umntwana esikolo busy azotesta for pregnancy and stuff.
And the nurses were very judgmental. They said a lot of things and they also altered ways like how come a student wants to test for pregnancy and HIV.
Then ngagcina ngatestanga vele ngahamba azange ngithole usizo.
And then I was not tested eventually and I just left.
Sanbonani.
Greetings.
Mina ngihamba iclinic yase Leslie.
I attend the clinic in Leslie.
Inkinga yami ukuthi Leslie like ba careless when it comes to files.
In Leslie Clinic, they are very careless when it comes to our files.
Sifika ekseni, sihlala ekudeni, sihamba ngeenyawo uke clinic.
We walk a long distance from where we stay because it's far to the clinic.
Masifika eclinic, simikisa amakhadi kuze kuphume ama-file.
When we arrive at the clinic, as usual, we hand over our cards so that they can retrieve our files.
Sihambe siyohlala phansi.
Then we get seated.
Maybe 30 to 40 minutes ababuyi kithi thina mele sihambe siyokubo futhi siyobuza ngama-file.
So we'll be waiting for about 30 to 40 minutes until we go back to ask about our files.
Masifika ama-file awatholakali basibhalela kumaphepha nje.
When we arrive, you find that your file is not there and they'll write on a paper.
While silinda le yonke le process abantu bayahamba like iline iyaqhubeka.
Whilst we are waiting, if they can't find the file, the line is continuing.
Yebo singisala sengiba simuva yebo. Then masifika phakathi i-medication still ayisitholi. Inkinga yaselesli lapho.
And at some point when you get inside to the consultation room, then they'll tell you there's no medication.
Then mele sijike lapho and sekulate futhi.
And then you have to go home empty-handed and it will be late already.
Sanbona.
Greetings.
Ngihamba eclinic yase Leslie.
I also attend Leslie Clinic.
Inkinga esibhekana nayo eLeslie last month ngaya ngithi ngiyoprevent.
Last month I went to Leslie Clinic for prevention for contraceptives.
Ngathi mangifika lapha ngathola omunye sister nje.
When I arrived there, I met this certain lady.
Ngathi lo sisi waba khona umbuzo ongibuza wona ukuthi nginangaki ngiyafunda nani nani.
And this lady started asking me, how old am I? Do I go to school? Am I studying?
Ngathi mangisuka lapho ngamtshela ngangaki wangitshela ukuthi umjova wukho and mina ngimncane ngakhona ukubekezela nje ngingalali.
So, and then they don't have another challenge that I have in the clinic.
Sanibonani.
Greetings.
Inkinga yami ise Mbalenhle extension 14.
I attend Mbalenhle extension 14 clinic.
Kolonya kupheleyo ndiye bendihlala eJoburg ndabuya ngengxaki ezingxamisekileyo umama mase sibedlele event.
Okay, so I was residing in Joburg and then I had to come back to Mbalenhle because my mom was not well.
Ngoku ingxaki yami zanikwazi uthatha itransfer for iclinic uthatha treatment.
So because I came back in a rush, I didn't take my transfer from Joburg.
Ndaya kwinyanga yokuqala bandenzela ifile.
I went to the clinic the first month. When I got back, they opened a file for me.
Manibuyela isibini bathi manize nefile itransfer.
When I went back the second month, they told me I need to bring a transfer letter.
Ndabaxelela ba ichance andinayo banikeza amapilisi ayi5 for 5 days.
I told them I do not have time to go back to Joburg, and then they gave me pills for 5 days.
Xa kuphela lamapilisi ayi5 ndabuyela futhi.
When after taking the 5 pills, I went back to the clinic.
Xa nibuya bathi ifile abaliboni.
When I got back, they said they cannot find my file.
Ndaphinde ndabuyela futhi ifile sebelitholile
And then-
sabanga nabo ukuthi mabanike ifile lami lihlale ngakimi.
So I went back again. This time they got my file, and then there was an argument because I requested that they give me my file to keep it myself.
So balithatha balidabula bathi ngeke bakhona ukungisiza nga-defaulter for 3 months.
So they torn up my file to say they're not gonna help me, so I ended up defaulting from my medication.
Ngize ngasizwa yi-TBK yaseBitali.
Then TPK are the ones that helped me from Bethel.
Ngiyabonga.
Thank you.
Sanibonani.
Greetings.
Mina ngihamba i-clinic yaseLeslie.
I attend Leslie Clinic.
So my problem is ngihamba ngaya e-clinic and bengikhohlwe i-appointment card yami.
I went to the clinic, but I had forgotten my appointment card.
Mangifika lapha ku reception ngabatshela ukuthi I forgot my appointment card for ukuthi ngikhiphe file because bengizele for prevent.
I told the reception that I forgot my appointment card, but I was there for prevention.
So lo bhuti beka lapho angitshela ukuthi in case ukuthi angisize ukuthi angikhiphele file semana ukuthi ngimnike inamba zami ngibe yi-girlfriend yakhe ukuthi azongisiza.
The guy that was helping me said in order for him to help me without a card, I must be his girlfriend, I must give my contact numbers.
So azangize ngivume mangavumi vele azange angisize so bemele ukuthi ngibuyele ekhaya ngiyolanda icard and it's a long distance ukuthi ngiyekhaya ngiyolanda icard.
So I did not agree with my numbers and he said he would not help me, so I had to go back home to collect my card.
Yes, ngiyabonga.
Okay.
Sanibonani.
Greetings.
Mina ngihlala eMbalenhle ngihamba clinic yase 19.
I'm from Balenhle. I'm attending clinic at extension 19.
Ngaye clinic ngiphethe ikhanda.
I went to the clinic when I had a severe headache.
Bangitshela ukuthi ngikhulele ngijike ngithenga iGramp.
They told me I might be pregnant, so I must go back to buy grandpa.
And zange ngahamba ngayethenga iGramp.
I went home and I bought some grandpa.
Mangifika ekhaya ngagula kakhulu ngagcina ngisesibhedlela.
When I got home, I got more sick and I ended up in hospital. Okay, thank you.
Good day. I'm attending actually at Bethel Hospital. Well, I'm a chronic patient in Bethel Hospital.
Ngihamba eBethel Hospital. I'm a chronic patient.
I've encountered problems. Being a patient there, there are certain medications which I have to take as a chronic patient. So I was referred to a clinic, nearest clinic.
So eBethel baye bang dikenda to a clinic eseduzane nami because of a chronic medication lebe kufuna ngithathile khona.
When I went to the nearest clinic,
mangifike clinic,
I was asked for a referral from a doctor. Hence, the doctor had told me that I do not need a referral letter.
To my surprise, mangifika clinic bangifune ukuthi I referral letter esuka ku doctor esibhedlele, but udoctor yena bengitshela ukuthi angidingi incwadi.
So I had to do the to and fro from hospital to clinic. And the clinic tells me that they do not have the medication that I'm taking.
And I clinic yase Leslie.
I attend the Leslie clinic.
Mina into engikhala ngayo lapha clinic yase Leslie is shortness of staff.
Leslie there's a shortage of staff in Leslie.
Yeah. So unokufika lapha ngabo 8 ekseni.
I arrive around 8 in the morning.
Basize mhlambe umuntu ishift yakhe uyophuma ngo3. Kulo 3 loyo usize abantu abayi5. Lapho mhlambe si20. Man complain akhale ngokuthi ngiwana ngengikhona kunisiza nonke ngesikhathi esi1. Kusho ukuthi laba abasele bawulinda laba bayongena ngesecond shift.
So there will be one nurse attending to the patient and should help about 5 out of the 20 that are in the facility. And when you complain about waiting too long, the nurse will say that there's nothing I can do because I'm alone. We have shortage of staff in this facility.
Ngiyabonga.
Thank you.
Sanibonani.
Greetings.
Ngihamba i-clinic yaseBethel.
I attend Bethel Clinic.
Bengigula then bangitesta ngenkani.
I went to the clinic because I was sick, but they forced me to test.
Mangitesta ngatholakala ukuthi ngiright then bangiphuzisa iphilisi iPrep bangakangichazelanga ukuthi yini umsebenzi wale philisi.
So I got tested for HIV and my results came negative and they gave me a pills. They said it's a PrEP.
Mangiliphuza sengizwa ngabantu ukuthi alihlali kakhulu emzimbeni sengiliphuzile.
So they did not explain what this PrEP is about, but I just took the pills and now I'm hearing from other people.
Mangiqhubeka ngilanda abangitesti mara basoloko bayanginikeza lona iphilisi.
So I'm continuing to go to the clinic to collect the PrEP, but nobody's explaining anything to me. Thank you.
Sanibonani. Mina ngihamba iMN Cindi.
I attend MN Cindi clinic.
Ngaya khona ngiyolanda iPrep khona ngithi ngiyocela iPrep khona.
I went there to get PrEP.
Okay, so ngathi mangifika khona so ngithi ngizothatha iPrep so baba ngokuthi so uyalala wena umncane kangaka and
So the nurses said to me, so you are having sex already, but you are so young.
so ngaziva nje ngijaje kakhulu ngacabanga ukuthi eish maybe ngijike but since sengikhona singisale ngena.
So I felt that I was judged, but because I was there already, I just said to myself, let me just continue and take the PrEP.
Okay, ngangena okay kwathiwa mele ngihambe ngiyotesta kuqala before ngiyithathe. Okay, sangena sa testa then azange bangitshele okuningi nje bangitshela ukuthi lana ukuthi 1 control niwena uzobona mangabe control kusho ukuthi right.
So prior to being given the PrEP, I was told that I have to go and test, and I went to the testing room, and in the testing room there was no counseling offered to me. I was just told that you see this thing that we are testing you, if it's 1 line you'll be negative, if it's 2 line you'll be positive. There was no counseling offered to me.
Okay, so after logo bangnika and the bangnika ipacket like eli1 so
and then they gave me 1 bottle of PrEP.
So ngaqala ngayithatha so ngaqala nga experience fatigue ngaqala nga experience diarrhea so I end up researching myself ukuthi yiyo vele kwenze so ngathola ku internet ukuthi okay kwenzeka so azange kahle kahle banginike information eqwele ngayo.
Okay, so I went home and I continued in taking the PrEP, but then I developed some side effect. I was fatigued, I was feeling tired and not feeling well until I had to go to the internet and research, and then I found out that those are some of the side effects. And at the clinic, they did not give me any information.
So angizange ngisabuyela khona cause ngasaba futhi ukuthi if ngibuyela khona futhi bazosho futhi bazophinda wena so ngaze ngayigcina ngayitholela khona indawo bathi iAnova so yilapho ngagcina ngithola khona usizo khona ngicine ngathola neinformation futhi ebengayazi mina cause I couldn't research more but lapho ngafika ngayithola information ngiyabonga.
Okay, so I never went back to the clinic. I was lucky to meet with people from Anova, and then they gave me more information about PrEP, and that's where I'm collecting my PrEP.
Sanibonani. Mina ngaseMalenhle.
I'm from Valentle.
Nginenkinga seclinic ePaulina Morapedi.
I attend Paulina Morapedi.
Yes, bengekhona eclinic ngine-infection.
I went to the clinic when I had an infection.
Yes, mangifika khona inesi la ngitshela ukuthi njalo nina manifika la nifiki nje ngesihle wonke umuntu makafika la ufika asho ukuthi unama infection kanti wayelala namadoda amaningi.
So the nurse said to me that you never come to the clinic on a good faith. Always you have problem. You are having STIs. Why are you sleeping around with so many men?
So vele nga decide ukuthi vele ngcono ngihambe vele ngasangisizi.
Then I decided to just leave the clinic without getting help.
Yes, namanye ngisabuke eclinic angisazi nestatus sami ukuthi ngiyagula noma ngiguli angizazi vele ukuthi nje ngikuphi.
So since then I never went back to the clinic. I don't even know my status. I don't know what's happening to me.
Thank you for those stories. And it's always hurting to hear such treatment, especially that patient and communities, more especially young people, are facing in our facilities, while we are always advocating to say young people need to access services, and knowing very well that South Africa has a high infection rate amongst young people, but the attitude that they are getting from facilities, it shows that is why we are losing so many young people in facilities. Before I go to recommendation, when we have these commemoration days like your World AIDS Day, I remember the theme of last year's World AIDS Day. It was saying equalize and integrate to end AIDS. So if we say equalize and integrate, but we still treat or discriminate patients in the facility, then how are we going to end AIDS? At SANAC level, we are saying leaving no one behind. But if you come to these spaces and listen to the stories, you can tell that we are leaving so many people behind, which is it's not fair. And for us to say we will end AIDS by 2030, it's just a dream for now as things are happening. The UN AIDS theme for last year, it was saying act, connect, and the pandemic. No, act, connect, and end the pandemic. How are we going to do that? So I think it's time now we stop using these nice words just to be seen in this big platform as if we are doing something as a country. But it's time now, government officials, implementing partners, come on the ground and see that with these themes that they are putting there to say this is how we want to end AIDS, are they working? Do they have a meaning to the person on the ground who will be turned back to say, because you have pain, you are not going to access services, because you're not going to give me your phone number, I'm not going to give you services. Those are the things that we need to continue to fight against, and we can't tolerate such things. But yeah, let's continue with our program, and we have few recommendations. First of our recommendation is that the Mpumalanga Department of Health should produce an annual report on the number of healthcare workers per cadre employed in each district, include number of people and size of areas covered by these healthcare workers, year-on-year comparison from at least 2021, the vacancies and the cost of this post to the government. Fill vacancies in 2023-2024 financial year. The department should extend facility opening times as per 2019 National Department of Health Circular. Utilize appointment days and time to ease congestion. Ensure filing system are maintained in an organized manner to reduce lost files. Open clinic grounds by 5 a.m. so that people can wait safely in the morning. Ensure files are not required for facility pickup points. People living with HIV go directly to pickup points to collect their RT refill. Get more people living with HIV into external pickup points to reduce congestion. PEPFAR should support filling all vacancies at PEPFAR Operation Putuma support facilities in short term. Provide additional staffing for all PEPFAR supported sites to extend opening hours to 5 a.m. to 7 p.m. on weekdays. Fund adequate numbers of adherence lab facilitators to allow for the restart of adherence labs. Recommendations to Broadbridge should immediately do an assessment in all POPs, PEPFAR operational Putuma supports sites with waiting time over 3 hours and develop a specific plan for each facility that will bring the waiting time below 2 hours. Support the facility to organize and maintain an organized filing system. Ensure files are not required for facility pickup points. People living with HIV go directly to the pickup point to collect their ART refill. Get more people living with HIV into external pickup points to reduce congestion. So we will now move to the art collection, which will be led by Comrade Lucky.
Good morning. Okay. The revised 2023 National Adherence Guidelines Standard Operating Procedure note that the constraints are a challenge to many people living with HIV, and that efforts should be made to support people living with HIV with suppressed viral loads to receive extended refills and or be enrolled in a repeat prescription strategy. Implementing this is vital to supporting improved long-term adherence. Ritshidze data reveal that there has been minimal change since last year, with 43% of PLHIV or people living with HIV interviewed now reporting 3 to 6 months ART refills this year. This is compared to 42% getting a 3 to 6 month refill last year. And it is well below the 80% of people living with HIV in 21 other PEPFAR supported countries reported to get 3 to 6 month ART refill in 2021. It is important to note the vast improvement in people not receiving less than 2 months supply though. There has been an increase in people using facility or external pickup points. Of people living with HIV interviewed by Ritshidze, 35% collected at standard medicine dispensing, with 42% collecting at a facility pickup point and 23% using an external pickup point. For those using standard medicine dispensing, 45% said they have not yet been offered the option to use a pickup point. All stable people living with HIV should be offered a range of repeat prescription collection strategy options as per the National Adherence Guidelines. Further, 50% of people living with HIV interviewed said they would like to collect ARVs closer to their home if there was possibility. There needs to be enough pickup points to decant people into especially linked to peri-urban and rural clinics. A diversity of external pickup points providers is needed beyond private pharmacy networks largely only available in urban areas. To service rural areas, small CBOs and early childhood development centers should be considered. In terms of adherence clubs, these options have been devastated since the onset of COVID-19. Most clubs have been suspended or reduced to being just a pickup point. We maintain that functional adherence clubs play an important role in supporting ongoing treatment literacy. Literacy and peer support to help people living with HIV stay on treatment. Importantly, in order to be effective, repeat prescription collection strategies should make ARV collection quicker, easier and more satisfactory for people living with HIV. Yet this is too often not happening. 39% of facilities monitored said that people using facility pickup points must collect files. take vitals, and see a clinician before getting their parcel. 78% of people living with HIV also affirmed that this problem that adds to delays at the facility. While it should take less than 30 minutes to collect your parcel and go, for the 3% of people interviewed said it takes up to an hour, and 7% said it takes up to 2 hours or more. Once enrolled, every effort should be made to keep people continually active. Reassessment should take place at each clinic consultation to understand if people living with HIV are satisfied using their pickup point or club. People living with HIV who are not satisfied or very satisfied, as reported by 12% of people using facility pickup points, should be offered a different option that better meets their needs. Now we'll move to community stories.
Ngiclinic engisebenzisayo iKemville clinic. Ngaze ngaba happy because treatment yami sengithatha eclips. But mase kufanele ngibuyele ngiyovuselela or sekufuna ngiyodonsa amagazi ngoba nakhona ufuna uphinde uqale phansi ukhiphe ifile. Ngizwa khona ukuthi ufuna uhambe ekuseni uze ubuya ntambama uthothi ulambile. Mhlambe into esifika yenziwe lapha ukuthi umpompe ucheck-e oma blood pressure or what lezo zinto lezo if kungashesha njengase-clicks la silanda khona i-medication yethu kusheshe nje nakhona ukuthi ukhipha lelo khadi then uyampontshwa ukuthola okay lezi ezinye izifo emzimbeni eyijwayelekile zi-right then bese basinika-ke i-medication yethu yiloko ebengingakujabulela mangathiwa kuyenzeka.
Ngihlala eLeslie ngihamba iklinikhi yaseLibuhang so ngiyahamba lo nyaka ngena eklinikhi lo nyaka lo ngiklinikhi ulanda amaphilisi ami i-ARV so that masifika eklinikhi kwathothi ngihambe ekuseni ngisuke ngibo-6 bengiphuzana lokwama emsebenzini fika eklinikhi sahlala basi-attenda besona ngama-5 sayangayo wathola ukuthi ngaloko bebasilula amanesi angithola ubazange sanakwa sajikiswa sekushayivele kuntambama vele sajikiswa ngabo-2-3 vele endlini ngafika ngo-4 sajikiswa kuthiwa sibuye ngakusasa masibuya ngakusasa kuthiwa bathi singathathi inamba sangayithathi inamba mala sanakwa late ngoba ngafika vele akusikho ukuthi ngo-9 sofike sithathe siphuma ngoba thina besi-dated based engasiya namhlanje so safike sahlala kwafaka ukuthi nathi sihambe nalaba vele i-data namhlanje so yiloko nje ongaphathi kahle uma kuseklinikhi yala kufanele ukuthi uyetorhweni uhlala uyodisha kahle sahamba nje vele ekuseni of course sesihambe ekuseni bathi sisheshe sifike sizonako sabuya mhlawumbe ngabo-12 vele washayela vele sesibuya mina ngeke ngathola ukuthi okungcono thina siyithathele amafayile yibona ngoba thina uma ngilahlile ngizokwazi ukuthi ngihlale eklinikhi imini yonke ngoba ngazi ukuthi lilahlwe yini ifayile so ngoluthi uma ufika eklinikhi uhambe early mhlawumbe khona ukhosi uphuthume khona awusakhona ukuya ndawo ukuthi uze eklinikhi uzohlala vele siyahlala and okunye amaphilisi ayibona akasinika vele 3 months manje-ke ngibe nenkinga igazi mina bengithathwa njalo bengibangithatha nini kahle kahle bekose bangithathe ngonyaka wami angisho uMarch bangangoMarch manje bathatha ngoNovember iyangicaka ngoba mangiye eklinikhi manje ngingabusini bathola ukuthi mina bebangangithatha igazi for 2 years bathi bagcina ngithatha igazi ngo-2020 ngiyababuza ngithi kanjani ngoba mina unyaka uphelile ngithathiwe igazi ngo-October phinde futhi ukuthi kose ngidonse futhi ngithathe futhi ngoNovember so mazofika inkinga ibe kibo ngoba mina angizazi ngidonsa negazi yayibona and ama-message bayasibhalela usokuthi leyo message igazi abakubhaleli isikhathi bebangibhalela kuthiwa umuze uzodonsa igazi ngiye ngokudonsa kusho ukuthi ukulahleka kwefayili lami kusho ukuthi ukulahleka kwefayili lami bangasakhona ukuthi bathole ukuthi mina ngidonsile igazi la ngidonsayo ngiyayibona ukuthi le nkinga yamafayili izohamba ibe inkinga vele sasiwathatha e-chemist omunye udokotela kuthiwa uhlophe la ngaseklinikhi yayike waphela kasawathathi khona kwathiwa ukuthi manje mina bekose bangifake ukuthi ngifike ngithathe nje ngiphume abasakhona ukungifaka ngisekho kusystem ngoba bebangangidonsi for 2 years and angazi ukuthi kanjani uphela uyophela mina ngikhumbula ukuthi ngadonsa akahlupheke ku-right ngoba ufika noma uba nesikhathi futhi uthathe undluliye la uyakhona iklinikhi likhona uhleli ukuthi kose mina ngithatha khona mara mina ngikhona ukuthatha khona ngoba mina sengifana nomuntu ongekho phela imafayili ami emthangithi ngaze ngidonsa amagazi for 2 years. Ungcono ngicela ukuthi okunye benze kahle ukuthi thina masifika sizofuna amaphilisi okay basibona ukuthi inani elingakanani elizothatha amaphilisi anifika kodwa ngeke baze basiqede sonke okay abanye bahambe bathathe ngaleke khona chemist khona clinic abanye babanake ngahle.
Into engichazayo eclicks njengoba ngithatha lamaphilisi wami lawa ama RIV khona ngiyafika ekseni ngiphume futhi ekseni angihlali ngiyangiphethe ipasi lami angithole even nomuntu oyi-1 ngifike ngene ngiphume mara ekliniki ngizohlala khona ngilambe ngize ngisuthe. Into eyenza ukuthi lana ekliniki bangikhiphe ukuthi sengidla kahle treatment yami njengoba ngiyodonsa manje June ngiyobuyela khona ekliniki 4 bayabona ukuthi sengidla kahle nami sengiyazibona umehluko.
Mina ngihlala ethanda ukukhanya ePietretif eMangosuthu ngisebenzisa iPolar Park Clinic la ngiya khona uma ngigula noma ngidinga usizo futhi ngisasa netreatment khona. Okokuqala nje mawuyokhipha ifile indaba ende kakhulu leyo. Ifile lakho kuthatha isikhathi ukuthi uthole iyaphela 2 hours ungakalitholi ifile. Emva kokuba solitholile ifile ulinda ulayini omude isikhathi eside. Okwesithathu uma bathatha lamagazi ukuthi mhlambe bayawathatha angikhumbuli bangichazela mina ukuthi kusuke kutholakale ini noma balithathele ukuthini. Bake bangichazela ngalokho ngakwenza bangwalanda eclicks emall eMfula Mall. Kulonyaka ngithe mangiya ngibuyela khona ngangawathola ngabuyela khona ekliniki bangitshela ukuthi asekliniki. Bangangitshela isizathu sokuthi uyekeleni ukuwafaka khona eMfula Mall. Kungcono kakhulu eMfula Mall lapha eclicks akuna queue mawufika bayaku-attenda basheshe bakunikeze treatment yakho uhambe ayipheli even 30 minutes ulindile. Akufani nasekliniki. Ekliniki uyihlala usalinde ifayili lokuyolanda amaphilisi. Uhlale 1 hour or 2 hours before uzothola amaphilisi. Kanti eMfula Mall uhlala 30 minutes. Ngingathanda ukuthi kube noshintsho ekliniki. Behlise isikhathi abasichithayo ukusihleli thina singasizakali ukuthi nabo benze izinto zibe fast ukhipha ifayili iphepha le fayili bakunikeza treatment hayi ukuthi usayokhipha ifayili because leyo nto leyo iyabambelela kakhulu.
We will move to community stories in the tent.
Ngiyabingelela. Ngiqhamuka ePietretif, ngithatha i-treatment ePolar Park Clinic.
I'm from Ritshidze. I attend Polar Park Clinic where I collect my treatment.
Okukhona nje kwa recently bengiyocela ukuthi bangijove umjovo lo wokuvaccine ukuthi ngingabi ne-flu.
Recently I had to be vaccinated for flu.
So into abangitshele yona ukuthi aba-vaccinateani bona. Into abayenzayo bakuvaccinate ngalomjovo we-COVID-19.
They told me they do not give flu vaccine, they only do COVID vaccine.
Sengababuza ukuthi phela lemjovo e2 enemini ngiyayazi ukuthi uyavaccinate uvaccinate i-flu. Bese nalo we-COVID-19 uwodwa angifuni we-COVID-19 ngifuna lo we-flu ngoba sekusebusika.
And then I explained that I know that there are 2 vaccines, one for COVID, one for flu, and because it's winter, I wanted to be vaccinated for flu.
Bagcina balile nje kanjalo bangitshela ukuthi kuze ngikhona ukuthi ngigweme ukungabi ne-flu ufuna ngisebenzise ama-lemons.
They did not give me the vaccine. They told me that I need to drink lemon so that I would not catch flu.
Baze bangibhalela ne-remedy kufanele ngiyenze ekhaya ngababuza ukuthi ngoba phela isihlahla sama-lemons anginaso so kumele ngenze njani.
So they wrote remedy script for me, but I told them that I do not have lemon where I stay.
Bangitshela ukuthi kufanele ngifune izihlahla ngicela emzini yabantu.
They said I should ask from my neighbors.
Yena okunye ngabatshela ukuthi ngoba manje vele ngiyagula kuzeni engakuthola for i-treatment ye-flu nesifuba.
And by then I was not feeling well. I asked if I can get anything for my chest and for flu.
Bangitshela ukuthi abanako nje komkhuhlane into esizayo i-home remedy.
They told me they have no medication for flu. I should use home remedies.
Ene wonke umuntu bekaphuma lapha yavele ngoba kusekusebusika kukhalwa ngomkhuhlane.
And a lot of people were at the facility, they were also complaining about flu.
Basitshela ngokuthi sisenza ama home remedy imithi yokukhwehlela yikho abantu bagula kakhulu kusebusika.
They told us that we should all use home remedies because there's no medication for flu.
Ngiyabonga.
Thank you.
Sanibonani. Ngiqhamuke ePiet Retief ngisebenzisa ePolar Park Clinic.
I use Polar Park Clinic. I'm from Piet Retief.
ePolar Park Clinic ngiyile ngaphethwe umlenze ngathi ngiphethwe umlenze.
I went to Polar Park Clinic when my leg was painful.
Bangitshela ukuthi abana amaphilisi banginika ibuprofen.
They told me they do not have medication and they gave me a brufen.
Ngabatshela ukuthi angisebenzisi nginama ulcers.
I told them I do not use brufen because I've got ulcers.
Bangitshela ukuthi angihambe ngeclinic ekhemist ngifike ngithenge ama multivitamin ngiphuze wona ngizoba ngcono bye bye.
They told me I must go to the pharmacy and buy myself multivitamin, then I'll be okay.
Ngababuza ukuthi ngingaya kanjani ekhemist ngibe ngize eclinic anginayo imali yokuthenga leyo multivitamin.
I told them the reason I came to the clinic is because I do not have money to go to the pharmacy.
Bangitshela ukuthi mali lokho abangitshela kona yiko kumele ngikwenze ngoba nami sengifikile la eclinic yabo abanayo imithi.
So they told me I just need to do what as they are saying because there's nothing they can do at the clinic.
Okunye bajikisa abantwana bajikise umntwana siswami ayize eclinic wafola ilayini wakhipha ifile wangena eguleni.
Another issue also, they turned away my sister's child who came to the clinic. She was in the queue for long, but they turned her away.
Makasaphakathi kumanesi athola usizo bamtshela ukuthi akajike abuyele ekhaya yolanda umzali umuntu omdala.
After she has consulted, they told her she must go back home and find come back with somebody older or an elderly person.
Wafika ekhaya wathola mina sahamba sabuyela futhi eclinic.
And I accompanied her back to the clinic.
Masifika eclinic safola futhi iline.
When we got back to the clinic, we joined the queue again.
Saze safika phakathi ngababuza ukuthi bamjikiselana.
Then we went inside, then I asked why they turned her away.
Bangitshela ukuthi abantwana baya overdose abanama cases abantwana abancane abaphuza abamaphilisi.
They told me that the reason why they could not hand the medication to the child is because children overdose medication.
Ngase ngiyababuza ukuthi yena lo uke wa overdose yini before.
I asked them if my sister's daughter had ever overdosed medication before.
Bangitshela ukuthi bayaqolisa ukuthi bangilande lapho bengikhona khona ukuthi ngikhaphe umntwana buye futhi eclinic baqolisa futhi nokuthi ngiphinde ngibambe iqueue kabili.
So they apologized for what they did and also for us joining the queue again.
Yebo ngase ngiyabatshela ke mina ukuthi ngelinye ilanga makufika umunye umntwana bangamjikise ekhaya bamsize bese bayasho ukuthi ababuya nomuntu omdala.
I told them that next time they shouldn't turn away the child, they should assist them and only tell them that next time you must come with somebody.
Bathi ngoba ngazi kakhulu kumele ngingasize eclinic.
They told me because I know too much, I must not come back to the clinic.
Okunye mawuchecka ipap smear ama results awabuyi.
Another issue also, when you do pap smear, you never get your results back.
Mawuhamba uyowafuna bakutshela ukuthi hamba ukhipha ifile.
When you go back for your results, they tell you to join the queue and retrieve your file.
Mawusutholile bathi vula phakathi ucheck ama uyibukele wena amaphepha lapho amhlophe afakiwe.
And when you got your file, then you are told to open the file yourself and look at the papers that are inside the file.
Ngathatha ifile ngahlala phansi ngavula amaphepha ngabuka.
I took my file and I opened inside and I was looking for my results.
Ayikho into engayibona ngazi ukuthi kuthini.
I didn't know what I was looking for inside the papers.
Ngabuyela ngabatshela ukuthi angiboni lutho.
I went back and told them I can't find anything.
Ngahamba futhi ngaya eclinic ngiyoprevent abaphinde futhi bangicheck ipap smear.
I went back to the clinic for prevention again and they did pap smear.
Bangifonela after a month.
And I received a call after a month.
Bangitshela ukuthi kufuneka ngiphuthume eclinic ngizolande ikumayelana ne pap smear.
And then they told me I need to come quickly to the clinic because it's regarding my pap smear results.
Mangifika khona banginika envelope bangitshela ukuthi angihambe nale envelope ivaliwe ngestaple abathi ngihambe nayo ngihambe ngiye esibhedlela ngakusasa ekseni before 8.
Then they gave me an envelope which was closed and they said I should go to the hospital immediately tomorrow morning.
Ngafika esibhedlela nayo kwathiwa hayi yini leli sinilindile vele ngabhaliswa eceleni bathi phuthuma egumbini eli number 5 khona lapha.
And when I arrived at the hospital, they said they were waiting for us and they said I should rush to consulting room number 5.
Mangifika khona khona omunye umlungu wesidudla wasibhalisa phansi wathi asicwalisa amaform.
And there was this white person who asked us to register on a form.
Basinikise theater basikhipha isicubu bangasitshela ukuthi for ukusenzelani bekwenze njani until today angazi lutho. Ngiyadinga ukwazi ukuthi kwakwenze njani namanje angazi next bathe bazosifonela abakase basifonela.
Then I was taken to a theater and yini isicubu
Something placenta whatever. Something specimen.
Sanmanani. Mina ngilanda amaphilisi eMbalenhle extension 14. Ngahamba ngayotesta ngoJuly last year.
I collect my treatment at extension 14 in Balenhle. I got tested last year.
Ngathola ukuthi ngipositive.
I tested HIV positive.
Banginika amaphilisi.
They gave me pills, medication.
Then emva kwaloko banginika idate ukuthi ngibuye ngizothatha amaphilisi futhi.
Then they gave me a date for my return.
Ngabuyela ngedate ngalanda amaphilisi.
I went back on the set date.
Uma ngifika lapha wathola ukuthi ngiba phambili then mabaqala ukusiza baqala ngabantu abasemuva.
When I got there, I was first in the queue, but they started with people at the back.
Okungazange kwaze wangiphatha kahle kwaholela ukuthi ngigcine ngingasayilandi treatment.
And that did not sit well with me, and I ended up not going back to the clinic.
Njengamanje angiphuzi treatment since ngadefault ngaleso sikhathi ngiyabonga.
And since then, I stopped taking my treatment.
Thank you. With those community stories, Sissy, they will take your details, yeah, and they will follow up with that case and make sure that you access treatment. And I think the Department of Health officials are also here. They'll make sure that they assist. Also with you, my sister, who has done something that you don't even know. It's on the Batu Pili principle. Everything that it's done in your body needs to be explained, and you need to provide consent, because you are not sure even if they've taken off your womb. You are not sure because they took something that you don't know, and that is not how things are supposed to be done. However, let's go to recommendation. The Department of Health should extend and implement ARV refills 3 months by the end of 2023, by the end of September 2023, and 6 months by the end of September 2024. The Department of Health and Broadreach should ensure all people living with HIV are offered a range of repeat prescription collection strategy options, and those enrolled in RPC are active. Ensure that reassessment of RPC options take place at each clinical consultation to ensure people living with HIV remain satisfied with their RPC. Ensure all facilities implement the 2023 adherence guidelines standard operational procedures with fidelity, including ensuring facility pickup points are a one-stop, very quick art collection only visit in under 30 minutes. No need to go to the registry, collect folders, see clinician, and etc. B, ensuring re-establishment or implementation of adherence club, including group facilitation component, increasing the number of and types of external pickup points to ensure urban and peri-urban and rural clinic have external pickup points, ensuring people going back to the clinics for their RCP rescript receive the rescript at the same day, on the same day, if clinically well, to ensure that no unnecessary additional facility visit, with effective recall system to action any abnormal results or elevated viral load. PEPFAR should monitor and hold accountable these DSPs to implement 2023 adherence standard operation procedures with fidelity. So I think listening from the stories also we heard that patients, they really enjoy taking treatment and at the external point. And I think that's where we are doing well, and we need to extend that. And as we said, that will ease the burden in our facility, and it will make things easier for the Department of Health to give proper services to people. So without wasting time, I will hand over to Simpiwe with the next group of art continuity.
Thank you, Chair. The next group of issues are on art continuity. People living with HIV lead complicated lives and may well miss appointments and even miss taking some pills. When they do, meeting them with support when they return to the clinic helps to ensure long-term adherence. But often when people living with HIV and key populations return to the clinic, they are treated badly, leading to people disengaging from care. A differentiated service approach is required for people living with HIV who re-engage in care. Some will require intensive clinical management, including advanced HIV screening and management. Some will require psychosocial support in the form of quality counseling and group support options. The majority need to be made easier to collect the treatment. These people should be offered multi-month dispensing and should be assessed and offered access to pick-up points or adherence clubs as quickly as possible. Implementing 2023 re-engagement clinical and adherence guidelines are vital to supporting improved long-term adherence and retention. Broadridge should support the remaining 78% of facilities and any others in the district in training or mentoring on the stages in the new 2023 adherence SOPs. Ritshidze data reveals that out of 971 respondents, 82% of people thought that staff were always friendly and professional. Gert Sibande was one of the highest performing districts on this indicator. 18% of people did still think that staff were only sometimes or never friendly this year, while down from 36% last year, should still be improved upon. This graph shows data across time with improvement in staff attitudes since data collection began in the district. All 10 of the top performing sites were in Gert Sibande on this indicator in the province. The district should continue to improve and ensure all people living with HIV, key populations, and other public healthcare users are treated with dignity, respect, and compassion at all times. It is also important to note that because Ritshidze interviews take place at the facility, people who have already disengaged from care due to poor staff attitudes, some of who we'll hear from in our community stories, would not be at the facility to interview. Out of 49 people living with HIV who had missed appointments, only 41% said that staff were welcoming when they came to collect ARVs if they had previously missed a visit, down from 53% last year. 31% said that staff still send you to the back of the queue the next time you come in. Yet, according to the South African National Welcome Back campaign strategy and the National Adherence Guidelines, people should not be sent to the back of the queue or made to wait until the end of the day to be seen. A returning patient should either be seen in a separate stream or take up the next queue space. Further, the 2023 Adherence Guidelines SOPs say returning or re-engaging patients should not be made to wait until last to see any service provider, but should join the patient queue on the same basis as all other patients. No punitive actions may be taken by the facility staff. While most people did not report transfer letters being a challenge, 43 people interviewed by Ritshidze had been denied access to services for not having a transfer letter across 19 facilities since we started collecting the data. While this represents just over 1% of all public healthcare users interviewed, given that most people interviewed are unlikely to have attempted to transfer services, it continues to point out to a larger problem regarding the communication and policies regarding transfer letters. However, it is important to note that this is far lower than Nkangala, where there were 236 reports across just the 4 facilities we monitor, representing 22% of people interviewed. Nkangala had more reports than any other district in the country, even among the few sites we monitor in Nkangala district. A reminder that transfer letters are not required in the guiding principles of the re-engagement SOP, which states, if a patient comes from a different facility, it is critical that the patient be provided with treatment on the day of presentation. While referral letters are helpful, a patient cannot be required to leave the facility without treatment. 158 people were interviewed by Ritshidze, who have been interviewed by Ritshidze had been denied access to services for not having an identity document across 19 facilities over the last year, representing 4% of all people interviewed. All sites should be investigated. However, in this reporting period, we are particularly concerned with Amsterdam CHC, Emelo Clinic, Ethandukukanya Clinic, Mkhondo Town Clinic, Piet Retief Clinic, and Tusiville Clinic. Again, people being refused access to services without an ID was worst in Nkangala, with 225 reports representing 21% of all people interviewed, far higher than in any other district in the country and needing urgent investigation. Again, it is important to note that Ritshidze interviews take place at the facility. Therefore, people who have already disengaged from care due to challenges accessing a transfer letter or not having an identity document would not be at the facility to interview. Psychosocial support is another critical element to ensure long-term retention. Yet, Ritshidze data shows that 39% of people living with HIV interviewed do know that psychosocial support is available. Gert Sibande performed worst across the country on this indicator. Further, a full package of psychosocial services are not yet available at every clinic. A full package of service should include provision of individualized quality-assured counseling to patients, peer-led patient navigators acting as a bridge between clinicians and patients, mapped networks or referral services, optional support groups, and food parcels. As part of psychosocial support, support groups should be linked to each public health facility that are critical to provide counseling and support services to people prior to testing, post-testing, pre-treatment, and those struggling on treatment or re-engaging in care after a treatment interruption. Treatment literacy also improves art continuity as people understand the importance of starting and remaining on treatment effectively. Of the 506 people living with HIV surveyed, 92% had received a viral load test in the last year. Yet, only 81% reported that they knew their viral load. There also remains a significant gap in knowledge and treatment literacy. Positively, 90% agreed with the statement. Having an undetectable viral load means the treatment is working well. Up to 80% last year, but only 69% agreed with the statement. Having an undetectable viral load means a person cannot transmit HIV. Positively, 3 facilities, as shown here, actually had perfect scores where all people living with HIV understand why an undetectable viral load is good for their health. Yet at others, fewer people living with HIV understood that an undetectable viral load is good for your own health. Further, 2 sites had perfect scores where all people living with HIV understand why an undetectable viral load is good for ensuring you cannot transmit HIV. Yet at others, far fewer people living with HIV understood that an undetectable viral load means you cannot transmit HIV. Only 37% of people living with HIV at Lebogang CHC understood, only 44% at Winifred Maboa CHC, and only 45% at Betal Town Clinic. This highlights that the messaging that an undetectable viral load prevents transmission, U equals U, still needs to be better communicated. Now we will move on to the recorded stories.
But ngihlala ePitretief eMkhondo. Ngisebenzisa iclinic yase Polar Park. Ngibe nenkinga la mangifika ngibuya eLukwatini, ngibuya ngetransfer. Sho ukuthi ngale ndaba zama lockdown kwamele ukuthi ngishintshe indawo ngibuye ngasekhaya because benginomntwana omncane ngiceda kudeda. So bekufanele ukuthi ngizocala isikali ePolar Park Clinic. Plus into bengiyisa khona ukuthi akusukala umntwana kuphela netreatment, ngithatha itreatment ye-HIV. So bangifuna i-transfer ngabachazela ukuthi bayithumelile kuma emails. Nedi bona kushoda ukuthi bayiprinte out. Bangibuza ukuthi wayibona bangayiprintanga out, why bangayiprintanga out banginike esandleni. Ngisatrayiswa yiloko ke manje bese ngididekile ukuthi kufanele ukuthi ngenze njani. Ngaze ngasizwa ngomunye usister khona la ukuthi lo sister ngimazele esontweni. Wakhona ukuthi angele lapha kulama clinic. Ngasi ngiyakhona ukuthi ngithole i-transfer. Angithi i-treatment ifuna ukuthi udle. So ngeke uhlala ungafuna umsebenzi uze ukhona ukuthi udle i-treatment. Una sister Nkosi lapha ePolar Park. Uma ufike late, mina nje ngaya kuyi-date yami but late ngokuthi bengiqala emsebenzini. Bangijikisa, bathi ngeke basangithatha ntambama. Angibuye ngakusasa ekseni bona sebayahamba. Kodwa i-file ngase ngiyiphethe ngesandla. So mangijika ngibuya ngakusasa ekseni, bangitshela ukuthi bekufanele ukuthi ngibuye ngayizolo ngithi mina izolo ngifikile mosine nangijikisa nathi nasenilate niyahamba. Bathi angihambe ngiyohlala edureni ngiqala phansi ngibambe line. Kodwa bengivele ngibambe line. Ngaphuma ke ngayohlala ngaphandle. Nakhona into eyangisiza ukuthi kuphinde kuchamuke futhi lo engimjwayele. Angikhiphele i-treatment, ngamchazela istory angikhiphele i-treatment. Akusiloko kuphela okwenzakalayo lapha. Even noma ngelinye ilanga uma uyokhipha ifile, bathatha isikhathi eside, ungahlala even 2 hours lapha ungayitholi ifile yakho. Lokho ndlulisa abantu nesikhathi siyahamba lokuhlele eclinic. Okunye mangabe ufuna mhlambe uyile noma ngabe umix umntwana noma ngabe uyawena. Kwesinye isikhathi banokukutshela nje bangabe namahloni ukuthi hamba uthenga ichemist ukuthi asinako. Bakubhalela ilist bathi yokuthola echemist. Uthenga ngani echemist imali ungenayo yethi kune clinic ye-government. Sembele kulama public clinic ngoba sazi ukuthi i-government ikhipha yonke into but bona they don't treat us well. Akusi right nalo ngoba usuke sowufikile vele. But abakutshela ukuthi usebenzisa kabi mangabe basebenzisa kabi sicela ukuthi ubozama ukuthi ubambe idate yakho but uma unesizathu futhi naso lesizathu kufanele ukuthi bas understand ngoba naba bekho perfect akekho futhi umuntu operfect amanesi okay akusiwona wonke akusibona bonke kuba nguloyo sister nje ukuthi vele mangabe kunguyo kulelo ward noma okuleyo office leyo usebenza ngaloko kulelo langa vele kuyabheda kuze uthi noma uye clinic ubuze ukuthi bani ungakuphi because sesiyabazi ukuthi bani usebenza njani.
Hayi ngathola inkinga ekliniki last year unyaka ophelile 2022 ngaya la ngikhipha khona amaphilisi e-pharmacy ngathola umunye usister vele lo sizayo ukhipha amaphilisi wathi hayi ngicela uhambe ngamafaya ayi-3 ekliniki bathi sifuna leli okhipha ngala amaphilisi treatment ngithatha esiya clinic inisiya clinic lo e-pharmacy amaphilisi ngathatha khona ama-RIV ami ngaphuzayo ngaya ku-sister lo wangijikisa e-pharmacy wathi ngicela ulande amafayili ngacela ngale efasteren ukuthi bangikhiphele bathi thina hayi sithola amafayili ayi-2 leli wena olufunayo asilitholi angeke sikhona ukukusiza wena if mangabe uyakhona thatha nayi lona ikhati lakho uzibhekele le file wena wabalifunayo le emaphilisini ngathola inkinga ngathi mina hawu nichaza ukuthini ngisibhekele bathi angithi asilitholi senze njani ngalibe ngibuka ngalithola egcineni hayi ngasho bathi mina cha vele i-treatment angeke ngisayithatha mina ngaphatheka kabi emoyeni wami ngaba buhlungu vele emoyeni ngaphuma vele inhliziyo yami seyitshekile seqondise ebhekele ngathi mina hawu kanti clinic basenzani ungazifunela ilokhu njani ifile kube kunabasebenzi lapha phakathi ibona ngithi abasiza abagulayo ngesinye isikhathi ngithatha lawo 2 months ngesinye isikhathi ngilawo 1 month bayasho ukuthi ubuye ngedate esokuzodonsa azo ngibuye ngedate sokuzodonsa ama-results hayi mina ngathi abachaza ngibona nje mina sasefayilini ungabona mina sebawaklippelile la fayilini ngibona sebawaklippelile.
Sanibonani, ngihlala e-Amsterdam eVezunyawo ngihamba ikliniki yase-Amsterdam ngingahlangana nenkinga bengiya ekliniki e-Amsterdam ukhona unesi nje ungaphathani kahle engingithi njalo bekumele ukuthi njalo kumele ngekliniki ngibe novalo lokuthi mengathola yena vele angizophuma ngingajabulanga ekliniki so kwakhosa ukuthi sengigcina sengisaba ngingasaya ekliniki sengihlala nje ekliniki uze ngidlule like ama-date ami and nakhona ukuthi bengihlala ngoba bengifuna ukuhlala bengihlaliswa ukuthi sometimes anginayo imali angisebenzi and vele angisebenzi so ngithi mengile afika ngithethise like angithethise into eningi ukuthi wayingaze ekliniki wangijampisa ama-dates nangabe ngifuna ukufa wayingafi ngasolo sibanyangisa so kwagcine sengiphoqa ukuthi ngigcine ngiyekele ngingasayikhona nangasayikhona ngagcine ngagula ngohlala ekliniki Petrative almost 3 weeks ngathi nasengibele ekliniki last of last week yes ngamfika kwami ngambona ngathi indlela angiphathe ngayo ngendlela bangiphatha ngayo from ekucaleni bengcono kunale bengikuyo manje ngithe mengiya kuye manje ngamthola nje right cool but ekuqaleni bangangiphathi kahle totally and akusingiyiwane engikhala ngayo lo nesi most of the people bakhala ngayo eklinik ukuthi akaphathani kahle amaphilisi angaphuza mina ama-ARVs ukuze ngiskiphe I think ngaskipha almost 2 months ngaphuza cha ngase ngabe ngicamba mangase ngawufuna umphathi wakhe and then ayangase ngakhompela ukuthi mhlawumbe ngiyamsaba or ukuthini bengisho nje like kulo sister lo lama-home base ngitsho mina ngiyasaba like eklinik ngisaba lo sister lo yabo bengikuye cha nakumphathi bengakashi ngakhompela ngicamba manga cha like bengicabanga lo sisi ukuthi if like ngizomtshela umphathi mhlawumbe umphathi uzoyibona like hayi vele ngijwayele mos vele ungathatha ama-dates benza kahle labo nice like bamthethise ngoba vele najampisa ama-dates na ufikile nje kuseni if ufike ngesikhathi bakufika nje bakusiza ngesikhathi babuka ifayili yakho bayenza into abakwenzayo bakubuza amaphili bakunikele into abakunikwana then bayabuza ukuthi why umisa i-date because of bekumele uze nge-date ethize bese uyachaza isitori sakho ukuthi there is no ngimisa i-date mhlawumbe benginamali noma bengibhizi somewhere then bese bakunika amaphilisi bakutsho ukuthi ungasamisa i-date just like that like nangabe asifani singabantu asifuna siphuma futhi emakhayeni afanayo ngeke futhi ngihlale phansi ngazi ukuthi ne-treatment ekumele ngilande i-reason ukuthi ngayilande mhlawumbe ngisongenamali noma nginamali okugibela so ngeke ngithanda ukuthi mhlawumbe abafana nami bakwazi ukubasiza nabanye abafana nami ukuthi mhlawumbe sebe ne-transport ezosilanda nakwama-dates wethu or mhlawumbe basithathele amaphilisi bawafake ku-mobile duzane ne-mobile yethu eseduzane sokwazi ukufinyelela khona ngoba esikhathini esiningi asinayo imali ukuya Amsterdam. Benginenkinga ngeyi-18 April ngokwi-date yami yokulanda i-medication ngidla ama-ARVs. So mangifika lapha hayi ngithola ukuthi li-file alikho. Ngiwalanda ku-mobile. Yibo bathi manje asishintshe le-Amsterdam clinic. Siwalanda lapha endaweni ngasesikolweni kaSibindi. Manje masifika-ke saba disappointed. Basitshela ukuthi asambe siye e-clinic. Manje e-clinic angikhonanga ngisho ukuya ngoba kwi-clinic ufuna ube ne-40 rand same time ube nemali yokuhamba ubuye. Le medication yami bengithathe iphilisi lilokugcina nje ekuseni. Ngambuza lo sister ukuthi manje ngenze njani ke? Wathi ke yena ngihambe ngiye kumuntu odla i-treatment efana neyami. Bese ke sengithola ilanga sengiya eNzasi eAmsterdam ngiyolanda i-treatment yami. Manje lokho kungihlukumezile kakhulu namhlanje sebengisacabanga nje ngoba phela uma uya le clinic ufuna uplane. Basikhiphe 3 years ago. Benzela ukuthi le baningi bantu eAmsterdam ba-avoid i-traffic le. Manje nathi ufuna siwathathe endaweni yethu lapha eVezunyawo. Ngiphatheke kabuhlungu vele, ngiphatheke kabuhlungu kakhulu ngoba angabe ngisazi nokuthi mangifika le-Amsterdam le file ngizolithola elikhona noma ekuchubekana angabe ngisazi vele. Ngihambile phela ngahamba ke sengiya kubomakhelwane sengiyabuza wena bowulapha bothatha iphilisi lani, abanye bathi ushukela, abanye bathi high blood. Ngibe nenkinga kakhulu vele ukuthola le medication lefana nale yami. Ngibe nenkinga mara ngigcine sengitholile nje kulomnye usisi. Yona lefana nale yami waseke uyanginikeza ke sengiqedile ukuya le Amsterdam sengizothatha ami ke amaphilisi bese senginikeza yena ke sengiyambhadala. Ngibe nenkinga nje lokuthi sengihamba ngitshela abantu i-secret yami ukuthi yeyeni bo umaphilisi ngiko lokhu kungidine kakhulu lokho ngoba bona ekucaleni bathi i-secret yethu.
Hi, igama lami Anonymous. Ngihamba eLebuhang Clinic ngiyocollect treatment yami. 3 months ago ngaya ekliniki. Mangifika ngale wellness bekulahleka ifile bangilindisa for maybe 2 hours. After 2 hours bathi ngiye reception ngiyofuna ifile. Mangiya khona lo sisi bekalapha reception wangibuza phakathi kwabantu ukuthi ngiyacala ukuza ngizothatha i-treatment nanje ngoba ngizolanda ifile ngalo hayi ngingayi ngale e-wellness. And makangibuza warasa bekugcwele abantu. So ngaphatheka kabi sagcina sesiphendulana kabi ngaphuma ngahamba ngayithatha i-treatment. After a week ngabuyela ngayithatha i-treatment bagcina ngami ngoba i-date bese indlulile. Ngafika ngabo 6:30 ngahamba ngabo 2. I-treatment engiyithatha ama-ARVs. Ngaphatheka kabi because ngaba embarrassed ukuthi ngibuze phakathi kwabantu and nokufika kwami ekuseni nasengibuyela the following week ngaphatheka kabi ngoba ngafika ekuseni ngahamba late. So ngahlala iviki lonke ngangaphuza until lelanga ngabuyela ngalo. Ngathanda ukuthi mhlawumbe si-attende early ngoba sifika early and basikele isikhathi eside sihleli lapha sigcine sesiphuma late. Bakhuluma nje gcine sophatheke kabi ngalo hambe. Khona umunye usisi wayemikisa umntwana yena. Uthi umntwana ngathi bekakala iweight encane ukuthi baphuma nomntwana ngale. Ebantwaneni bamphakamisela wonke umuntu ukuthi ambone. Bathi bheka umntwana wakho uneweight engakanani. Vele wagcina lapho. Azange asaye kuyokalisa umntwana nama vaccines angasamnikisa.
Ngihlala eMbalenhle. Ngihamba iklinikhi yase-extension 14 ngithatha iphilisi yama-ARVs ne-TB. I-challenge engiba nayo ekliniki ukuthi amanesi awasiphathi kahle and nokulahla amakhadi. Masifika laphayana basinikeza attitude sibone wonke umuntu ukuthi thina sithatha ama-ARVs sesanje siyakhulunywa la elokishini bese okungizwisa ubuhlungu kakhulu phela maselikhulume kabi sobone nabanye abantu asoyakhathala eklinika awusakhona ukuthi uye ngeconfident yolanda amaphilisi akho cause sosaba ukuthi uhlazekile ucale bese ke sisiya defaulta ke naso phinde futhi ubuyela kuba buzukuzuku futhi asikhona ukuthatha kahle i-treatment yethu extension 14 ngeservice yakhona umsindo siyathethisa nje amafayile ethu ayalahleka mawukhuluma inkinga yakho ukuthi iphilisa likuphathi kahle leli bakutshela lokho abakutshela kona usho ukuthi isimo sakho sokuthi ungakhona noma wathatha amaphilisi siyachaza nangabe isimo sokuthi awukhona ukudla kahle ukudla ukuthola ngokwanele usacela ukuthi bakuphe umdoko or bakutshela ukuthi umdoko awukho manje nje le ingizwisa ubuhlungu kakhulu.
Dlala nontombazane ePola Park iklinikhi engisebenzisayo eMandikeni Kenville. So 2021 bengikhulelwe ngifuna usizo ePola Park ngangalithola ngaya ke ePola Park iklinikhi ngayokwenza ilokhunja ngakwadingeka ukuthi kumele ngenze ikhadi ile maternity lokukhulelwa bangathi ngeke baze bakhona ukungisiza ngokuthi ke angiseke wala futhi bengakayiphathi netransfer ngokuthi vele bengasiwa la bangifuna itransfer yaseSwazini ngabatshela ukuthi okay ngihlala ekudeni futhi nalana sengithola umsebenzi ngahamba ngalo December lo ngaya eKenville but angisakhumbula ukuthi beyingakhi date umuntu osiza abantu abakhulelwe vele ulo Sister Nkosi wafike wangisiza uSister Nkosi eKenville ngendaba yamaphilisi wangibhalela washo ukuthi kena incwadi abanendaba nayo ukuthi kanjani ezilongo ngisizakele endabeni yamaphilisi ukuthi ke ngikhona ukudla treatment mangiwazi amaphilisi ami bazongidonsa igazi ukuthi vele isiqiniseko sokuthi ngiyawadla amaphilisi ngoba ekhaya kusekudeni angeke futhi ngizingibulale ingane ngenxa yokuthi ekhaya kusekudeni kumele ngicingane nama transfer washo ukuthi uzongisiza ungaqhubeka njalo wangitreat lokho ngitreatwa nguye wangishintsha ngoba bengidla amaye bengiphuza la wanga2 wangishintsha wanginikeza iLTD laso Scopotinus Blue ngahlala i3 days ngakawaphuza uma ngikhumbula kahle ngoba ngayilangeni lesi3 eKenville bafike bangisiza ikhona eKenville till today vele ngasizwa nguSister Nkosi ube bengasinguye mhlawumbe engabe ngithanga wathola ngoba vele iPola Park azengibaze bangisiza so lo ngisaqhubeke inlo eKenville ayikho iklinikhi engiathendayo yebo kuke kwaba khona ukuthi nje endaweni njengase clinic ePetritif le isedrobheni etown nakhona bekubantu nje abangifuna ID sothi bafuna ID ngesikhona ukusiza kufunakala iID na sibone ukuthi vele kuyaklikha yini nalena cause nami ngicabanga ukuthi njenge clinic modinga usizo ugula manje bayakusiza yebo bengazi ukuthi uma ngabe uthatha amaphilisi sazodingeka incwadi mele click mina bengicabanga ukuthi mhlawumbe bakuthatha igazi njoba bangenze Mandikeni babona ukuthi okay igazi lakhe lo muntu liso uyasibikela ukuthi okay isimo sakhe vele wazalwa naso kanje kungiphatha kabi ngoba special nje kithi moseswazini asikwenzi noma ngabe kuthiwa umuntu ufuna usizo.
Okay ngihamba isiya clinic mina angeke ngizisho igama ngihlale extension 6 ngoJuly ngilahlekelwe yifile eclinic ngaba ku default yokuthi angisaphuza amaphilisi for 3 weeks so kuleyo 3 weeks ngingaphuzi ngayo amaphilisi ngabuyela ngathi mangibuyela bathi bafuna ungiqalelise linye ifile phansi benze linye ifile phansi ngathi mina ngoba sengiyagula and sengihamba nabo doctor manje yabona ngoba ngaye ku doctor kayi1 uKarim ngizizwa ukuthi sengiyashake akusahambi kahle la kimi emzimbeni amaphilisi benganawo ngabuyela mangenzela ke lawo lelo file banginika ibhodlela eli1 bathi elinye ngibuye ngizolicollector because ngithola 2 yamabhodlela and ezavela aseboxini mara lo la ngakhishelwe li1 nganikwa lona ngabuya ngachubeka ngamaphilisi ami ngaphuza wona. Yona iclinic ayisiphathi kahle kwesinye isikhathi vele. Awekho. Ngavele nganikwa nje amaphilisi ami bathi hamba uphuza amaphilisi akho uzochubeka ube right uzophila. Ama results ke siyathathwa amagazi ngoJanuary ngidonse January mina. Ukudonsa kwami January abasitshela ama results mayebuya ukuthi sime njani asifundanga thina ngithi. Kumele ngifundele ukuthi ama results amathini. Uma ngimbuza mina ukuthi ama results wami athini uthi asharp. Ama results wakho u right asharp mara ngiyazizwa ukuthi kwesinye isikhathi angibi right ebusuku nangilele kodwa ngeke ngiqhazeke lo ukuthi kwindaba angazi ukuthi nabasifundele vele sidonswa nje amagazi kuphela. Mina ngisuka la ekhaya ngo6 ngiye eclinic mangifika lapha eclinic ngo6 kukhona abanye abazobathatha laba beyikhathi zango10 ebekiwe babathathe bathi mabaceda bathi hayi sesifuna laba bangena ngo8 ene mina la isikhathi ngibekelwe sona ekhathini iappointment yami u8 ekseni mara bakwenzi lo ukuthi baniqale ngaloyo 8 u8 uyashaya sihlele etulweni ngapha sambe singakadli thina njengami mina ngikhona ukudla ekseni funa ngidle mase ngibuya ngidle ngithatha amaphilisi ami ngiphuza hayi basichazela ngendaba yama appointment. Kodwa manje abasawagcini lama appointment abawagcini basichazela bona bathi senzela ukuthi ningabi banengi eclinic senzela ukuthi nibe bancane isikhathi lesingene labo isikhathi lesingene labo lami ikhathi libhalu 8 kodwa ngiyabuya la ekhaya ngabo gora to 12. Ngithanda ukuthi ngibone iclinic isiphatha kahle bagcine isikhathi sethu benze yonke into eright esibonayo ukuthi lento le iright engabonwa yimi ngedwa ngoba vele siyakhala sinokukhala ngoba uma sebakhathele bona ukusebenza laba abanye abantu banokuthi babe sebasithethisa sibadala thina siba abantwana njengami phela mina ngina 57 ukuyothethiswa umntwana engimbona ukuthi lo intanga yomntana akusi right. Isikhathi ngisigcinile angibuza ukuthi why ufike ekseni thina sisalele ufikeleni ekseni ngoba isikhathi sakho 8 uma uzame ukuthi ufike ngalo kora 8 ufike eclinic kora 8 uthi ngo8 ngizosizeka abakusizi ngaleso sikhathi yebo ayinto yaseclinic yona yakwatisa mawucabanga ngiyakhona abantu abaningi sifa ngalokuthi vele sesiyabhoreka hayi baningi engibaziya abagcine bangasayi eclinic baningi.
We will move on to the in-person testimonies.
Sanibonani.
Greetings.
Bengithatha amapilisi eLeidenburg.
I was taking my treatment in Leidenburg.
Ndeza apha eMelo.
Then I moved to Emelo.
Acaba ukuthi anginayo imali yokubuyela emva.
I didn't have money to go back.
Ndeza kule clinic yalapha apha eMelo.
Then I went to the clinic in Emelo town.
Ndizocela amapilisi nabachazela ukuthi mina ne-TB.
I went to ask for treatment. I also told them that I have TB.
That ndiphuza ama-ARVs.
I told them I take ARVs.
Bathi bafuna transfer ngatransfer anginayo.
They told me they need a transfer and I told them I do not have a transfer.
Bathi amapilisi asinikezana ngaphandle ka transfer.
They told me they cannot give me treatment without a transfer letter.
Hayi ndathula ke nami ndabamamela.
I stood up and listened.
Ndithe ngisobaxelela ke ngondathi xa ningafuni ukunikeza amapilisi nithi mina ngizokusela ntoni ke ngo.
So I told them that if you don't want to give me the treatment, what do you think I'm going to take?
Hayi ke bazamile ke bandipha ke ngoJanuary amapilisi.
Then they ended up giving me treatment in January.
Ekuzameni kwabo bathi bazonikeza amapilisi azogqiba inyanga.
They told me they'll give me 1 month supply.
Kodwa ndingaphinde ndibuye ndizothatha amapilisi. Oh,
but I should not come back to collect treatment.
Ndathi yini sisi ngoba lokhu iTB yabulala.
I begged the nurse to say TB kills. I need my treatment.
Hayi ke. Baphinde banika kulenyanga pheli lenyanga phalipheleyo
ngoba besinendina 2 months ndingawadla amapilisi e-TB.
Then I had defaulted for 2 months, but last month again I went back to the clinic and they gave me the pills.
Ndaphinda ndazama ke banginikeza ke kule nyanga iphelileyo le bathi sisi ungaphindi ubuye ngawogqibela la.
They told me last month that this is the last medication they're giving me. I should never come back.
Njengoba nje nami nje ndizibhekile ngibona ngathi vele ayingomzimba wami ngoba vele i-TB vele iyakhawulezisa vele i-TB faster ayenzi kancane.
So as I'm looking at myself, I think this is not the way my body is because of TB.
Hayi mina sazi shem uthe egqibeleni senihleli seningenawo ke ngoku amapilisi.
Then I
Ndacela
was-
kwenye intombazana yanginceda ngawo amapilisi.
So I was sharing
Yamvuza.
medication with another lady because I did not have any medication.
Andazi ke kwafika endlini isusa isibhelinda ngingazi ukuthi naye ebe into le ive seyamphosela endlini ngoba vele benengxaki qha bengazi ukuthi ngizamthola kuphi uyabo nenamba yakhe ke lo ebenayo endlini ebengekho ngoba bendiziva ukuthi vele ngose ngiyagula kunamapilisi mhlawumbe nguye umuntu onganginceda kule ngxaki endikuyo andazi ukuthi mhlawumbe uthunyelwe uNkulunkulu uthunyelwe yini wavese waqhamuka ndathi hawu uNkulunkulu nami kusho ukuthi sengiyaphila hayi wangena sibhelinda no professor endlini Dabe senibabekela le ngxaki ngithe ngisababekela le ngxaki yami Oh kuyamiwa na
Okay, so when I was at home, I didn't have medication. I was so stressed and I didn't know what to do. I tried to look for contact details of Belinda and none of us in the house had, and fortunately they came through to the house.
Hayi ke ndithe ngisababekela istory khange bathathe nemizuzu engakanani bathi khwele emotweni
When I explained my story, they got me to the car.
hayi bakhwele emotweni bathi khawusihambise kulo sisi lo bengafuna ukunikeza amapilisi ke simjonga ukuthi ngibani uyalazi igama lakhe athi angilazi kodwa yena ndingamkhomba
So they took me to
Eva.
the clinic and to find the lady that did not want to give me the medication.
hayi ke ndithe ngizomkhomba lo sisi wathi sisibhelinda hayi kamyekele kancinci kodwa ndizombuya ndimbone sendiyi-1 saya komnye usisi ententeni sathetha nalo sisi oh
So
zothatha
when-
izitori
Went to the tent and spoke to another lady.
hayi ke ekukhona mani kutheni ngane oh bona bangincedile shem ne ngoba okay sathi wathi sisibhelinda mayigqiba othetha nalo sister kodwa naye wamchika mbonisa isibhelinda ukuthi unyanyile yeva efuna undinika ifowuni yakhe sefuna ukubetha lo sisi ndathi hayi ungambethi sefuna ukumbetha ngoba aba bantu bahlala kwezinto ezicofayo vele bazenza ngathi bafunde kakho xa bebona umuntu ohamba ngeenyawo
So there was alteration in the room where the lady that was helping us was having an attitude, and Belinda was also getting emotional in the process.
okay ke phaa ke ngokwathi ndibuye namhlanje yeva ndizojonga ingxelo
So they then said I should come back on Thursday today so that they can assist me.
hayi kusho ukuthi bethuka ke ngelalanga kaqhamuka usisibhele ndithe namhlanje mangifika i-transfer ikhona bebetheni bangayifoneli ekuqaleni hayi bo
So today when I arrived at the clinic as agreed, my transfer letter was there, then I was assisted.
ndiyambuza lo sisi ukuthi ubungayenzi ngani le nto kwasekuqaleni ngoba ndinathumba singawadla amapilisi e-TB
So I asked the lady, why didn't get my transfer all along since I even defaulted for 2 months?
athi lo sister mahlala sesiyeka singabusayisa phezulu uthe ubhuti utata lo hayi kuqaleni ma efika ezongilanda ngemoto sithi iqaliwe imeeting ubhizi lo sisi ke ma ungibuza inkcukacha zantoni ngoba nayo i-transfer ibhaliwe kaloku uyayiba uvese wanyanya wathi sosubeke le nto phaa andithi bebengakunikwa sekuqaleni masihambe siye emeetingini uzogqibela ngayo le nto yo ndave ndahleke eva ndathi uNkulunkulu nawo hayi ngiyabonga shem nkosi yami hayi ngiyabonga manje sengizowadla amapilisi e-TB mhlawumbe ngizoba ngayo ngoba bayakhuluphalisa lo
So through it all, I'm very grateful. Now I've received my treatment and I'll take my treatment. Thank you.
Sanbanani.
Greetings.
Yeah. Mina ngithatha i-treatment e-clinic yaseLeslie.
I collect my treatment at Leslie Clinic.
Yeah, istory sami sokuqala esase-maternity.
My first issues regarding maternity.
Azange vele nje yangiphatha kahle le ndaba ngizokusho nje lokhu ukuthi now bengazazi ukuthi ngi-HIV positive.
I did not know that I was HIV positive when I went to maternity.
Obviously bayakutesta benze yonke into kodwa kuthena sebaqeda ukungichecka sebakunika i-treatment lezi sama naba folic acid vele ze maternity ze pregnancy ne kwatholakala ukuthi banginika nama ARVs bangangi-explainelanga nix mina bengazi next ngokuthi i-treatment lena injani iphilisi lakhona linjani and by that time beqala wona beqala i-FDC.
Okay, so as a procedure, when you go to the antenatal clinic, they also test you for HIV. So they tested me for HIV. I was not told anything. And when we were leaving, they also gave me ARVs and they gave me folic acid. I did not know anything about ARVs.
Yebo and kusho ukuthi kahle kahle mina ngazi expose ngoba phela ngiphuza amapilisi mina ngikhululekile ngisendlini ngiwabekile up until kuze kufike lo munye ubaba ebese ngisebenza naye kwi support group after sengithole le ndaba ukuthi kuyabheda lo baba lo athe mos lamapilisi waphuzayo wena anje nje ngithi mina hayi njani athi mosona vele uphuza into eso ngithi azange bangichazele next mina ngazi ukuthi ngiye-maternity njenga wonke umuntu bafika banginikeza bangitshela nje ukuthi ngisolo nje ngibuya nje ngizothatha.
So I took the pills with me and I went home and I continued taking the folic acid with the ARVs without knowing. I kept my container where anybody can see, and another colleague of mine came through and said to me, so you are also taking ARVs. And I did not know that those pills were ARVs. I was just taking them as I was told to take them and keep on coming back to the clinic for more.
Bese enye indaba engazange zingiphathe kahle ukuthi last month ngi9 bengolanda i-treatment yami kanti futhi bekuyinyanga yami yokuthi ngidonse igazi.
I also went back last month around the 9th and it was my date to collect my treatment and also to take my viral load test.
Ngithe nasengifikile ekseni usually nginokuthi sengiya late yabo ngabo 11 12 ngoba ngenzela isikhathi ukuthi kuyafana noma ufike ngo5 ekseni vele labantu ebafike ngo5 ngiyabathola banga-attendwanga njengami ozofika emini. So last month ngathi yazini athi ke ngihambe kahle nami ekseni ngisibona ukuthi kuzoyenzakalani ngahamba kahle ekseni ngafika ngabo 6 mangifika ngama maybe about 2 hours ngilinde ifile lithe nama seliphumile ifile bathi okay siye ngale wellness ngaye wellness ukuthi ngo-collector i-treatment.
So usually I normally go to the clinic around 11 because it's useless for one to go in the morning because when you arrived around 11, people that arrive at 5, you still find them in the clinic. But this time around, I said to myself, let me try to go early and see what is happening. Then I went to the clinic, I arrived there around 6 and I waited. And then they told us to go and retrieve our files and as we were proceeding,
ya ngafika ngale ngalinda ukuthi nakusalindile njalo kwashaya abo 2 ikhathi and by the time uqaphela ukuthi bekuna kubanda yonke into awuhlaliswa phakathi uhlaliswa ngaphandle eLeslie awungeni vele phakathi.
And mind you, at Leslie Clinic, we do not enter the clinic. We wait outside, and that day it was raining and it was cold.
Ngangena ngathi nangena kuthena cabanga from ekseni ngabo 6 lapho kuthe ngabo 2 sekukhona umunye umfana osebenzayo uyasebenza ke lo mfana uyavolunteer wasichazela yonke into sekathi abazodonsa amagazi izinto zokudonsa amagazi azikho sicela ukuthi nijike.
So around 2 o'clock, another guy that is usually helpful in the facility explaining the processes for us came to us and told us, those that are here to take blood, please go back because we don't have equipment to draw blood.
Ngahamba ngalibeka bekuyi Tuesday ngabeka ifile lami bathi ngizolithola kuye mase ngibuya ngolesihlanu ngabuya.
So it was on a Tuesday and the guy said we should leave our files by him and we should come back on Friday and go straight to him.
Mangifika ngolesihlanu
when I arrived on Friday,
akekho ke kumuntu le nesilithi alikhona ukungisiza because le file abalikhiphile alina information ngihambe ngizikhiphela.
So the nurse said she can't help me because the file they gave me doesn't have any information. I should go back and look for the file myself.
So nangaleli bangisiza khona reception bavela bathi bona balithathe ifile information yami. Luckily ngiyayazi treatment engithathayo nama grams wami kwakose ukuthi ngimtshele unesi ukuthi mina nesi ngidla 1 2 3 ngabe bengayazi bebazonginika treatment wrong.
So I went back to the reception to ask for another file. They told me that there's no file. Where must they get the file? And then I went back to the nurse. Luckily, I knew the kind of treatment that I take. If it wasn't for that, I was going to be given wrong treatment.
And ngithola abantu abajikiswe ngolesibili abajikiswe ngolesithathu abajikiswe ngolesine sekuphayilele nakusasebenzeki ngiyabonga.
And on that Friday, there were people that were turned back previously on Tuesday and Wednesday, and now the clinic was congested. Thank you.
Sanibona.
Greetings.
Story sami sikanje kusho ukuthi ngokuhlala kahle kahle ngosenhlazaji.
I reside in Hlazatshe.
Ngiyetanga lana last year October sekatophela so kusho ukuthi ngabambela lo sikoni wami emsebentini.
So I came this side around end of September. October.
Kusho ukuthi ngabe sengiyaphelelwa ngidlalawo ma ARVs.
So then I ran out of ARVs.
Ngaye clinic 19.
Then I went to extension 19 clinic.
Ba ngakhipha ID mabaveta lapha computer kwatholakala ukuthi ngihambe ilo inhlazatshe clinic.
So I produced my ID and they punched it in the computer and they said, but you are attending Hlazatshe clinic.
Ngabe sengiyabachazela ukuthi ngite unexpected so bengisacela because bengiphethe lelithini nelikhadi lami.
So I explained to them that I came to Mpumalanga unexpected, but I had with me my ID, my card, and my empty container.
Bangisha bathi ngenhlazatshe transfer.
They didn't ARVs. They said I need to go back to Hlazatshe or I should come back with a transfer letter.
Bangisha njalo ngahlala 1 month yathi kule yesi2 ngaqala ngavelwa something like mabhola so lamtimbeni ngasebeleni.
So I didn't take treatment for about a month, and in that month I started developing some lumps around my body.
Ngahlala abanye bosesi labagqoka in navy blue ngabe sengikhuluma nabo.
So I met with some ladies on the road who are wearing navy blue clothes.
Ngabe sengibangihlanganisela nase clinic yase 14 because bebancishe 19.
So I explained my story and then they asked me to meet them at extension 14 clinic. I went to meet them at extension 14 where I got assisted and I received my ARVs. Thank you.
Dumelang o buang ka pele ka mona ke Sonto wa Skhosana. Okay, nna ke le ka hlahela ke bothata last year. A ke tloa feedback ha bomme wa ka feedback ha bomme wa ka ba nne ke dula teng.
I'm from Fiesback, from my mother's place where I was staying.
Okay, kaya clinicing ya 4. Aki fitla clinicing ya 4 ka thola sister o mong ene ke na le ngwana wa 2 months ngwana ka na le mnyane ena na le 2 months ke tsore transfer aki fitla clinicing ke bua le ausi ena sister okay ke tsore transfer ke ena ke kopa thuso ai sister yenona ke sister mo sisanyana mo binyana so aki mo tsibi sister ye sister yena re ai ausi rena gona ro thusa nna ke tjagile jwale ke batla o chaise.
So I went to the clinic in extension 4. I was then breastfeeding and I ran out of treatment. But when I left Fiesback, I'd asked for my transfer. So I went to the clinic with my transfer letter. But in my arrival to the clinic, I met this lady that was not so good looking. She told me that it's late, she's not gonna help me and I should go back home. And I was trying to explain that I'm taking ARVs and I'm breastfeeding. So, and I ran out of ARVs, but she said no, she's in a hurry. She knocked off already, she was not gonna help me.
Sister yena o itse qeta o tsho jwalo yona we ke yona o siena ke sa mo thumela ke sa mo otla ka nkana ke kukile le ngwana ene ngwana ka o munyana ene jwale se ke le wa re tu ba ngwana ka o nyanya letswele ke tla mnyantsha jwang ke sa nwa pilisi yake.
So the way I was so upset because I was thinking of my child because my child is very young and I'm breastfeeding, and how am I going to breastfeed my baby when I did not take my ARVs because I was told I must take my ARVs.
O itse ha o tloa mono le nna Nkangala he hobane sisa e nna buile hore ha bana kgona ho nthusa ka tsamaya ka ya ntlong ha ke fihla ntlong jwale ke se ke le stress hore yo nna we philisi ke tlo e nka kae wa tshwanetse ke zule he ke tlale straight ke fihla mokgotsi wa ka mokgotsi ke kopa ngfe philisi e one ke kgone ho nwa hoba ke tlo kgona hore ke nyantshe ngwana le tswele mokgotsi wa ka ngfe philisi e one o itse a qeta ngfa philisi e one ka enwa ka kgona hore ke nyantshe ngwana ka la hosane ka kgutlela hape tleliniking.
So I was very stressed as I got home, and I went around to ask for people who are taking the same ARVs, and then I got one lady who gave me one ARV, and then I took it. Then next day I went back to the clinic.
Ke itse usana ke fihla he ka tleliniking ha wa ba mono ke mono he se ba kgona ho nka transfer la ka ba kgona ho rang thuso hobane a ka thola a usiwa sister no maobane a ka mtshwana ne ke thotswa mo sister ene o che yena ke batla mo huela maka o le wa nthusa o le a usiwa no a kgona ho rang ne di please ka ke tsule se ke watla le for sure he se ke thabile ke a lebo.
Okay. So the following day, when I went back to the clinic, I didn't meet the same lady I met yesterday. I met a different nurse, and then she assisted me. I got my treatment, and when I left the clinic, I was happy to this day, and I was even dancing.
Sanibonani.
Greetings.
Mina ngithatha treatment eBedal.
I take my treatment at Bedal Town Clinic.
Okay, at first banginikeza treatment ukuthi ngiphuze ekseni bengiphatha kahle.
At first, they were giving me the treatment that I was taking in the morning, and I didn't have any problem.
So okay, after ngicede ukuthola umntana ngangibuyela ekliniki bangichange banginikeza treatment ukuthi ngiphuze ekseni. Because azange bangichazele ukuthi why bangichange nje treatment.
So after I had a baby, I went back to the clinic, and then they changed my treatment, and they did not explain. From the one I was taking in the morning, now I was given the one I must take in the evening. Oh, vice versa.
So ngayendlini okay ngayiphuza treatment lokhu ngiphathe kahle ingulisa kwathi ngedate yami appointment ngabuyela ngabachazela ukuthi okay treatment enginika yona ngiphathe kahle azange baze bangina cause baphinde banginikeza yona the very same treatment le engangiphathe kahle.
So I continued taking the treatment, but I was not feeling well. And when it was my date to go back to the clinic, I went and I explained to the nurse that the treatment that I'm taking currently is not sitting well with me because I'm feeling sick. But they did not pay any attention to that, and they gave me the same treatment again.
So ngadibana labo sesibama home base ngabachazela then bathi next appointment bazohamba bayokhuluma nabo eclinic then if aba change ke ngiphinde ngibuyele kibo so ngilinde bona ngiyabonga.
Okay, so then I met with the ladies from the home based care, and I explained my story to them. They said I should take my treatment, and on my next appointment they will try to assist me to explain to the nurse what is happening with me.
Thank you with these stories. Before I read recommendation, I just want to comment the clinics that always make sure that they explain the importance of undetectable viral load to patients, because it makes it easier for patients knowing that when they are taking their treatment, they will continue to live longer and they can transfer HIV to other people. But also, it's important also to comment and acknowledge people who are doing right in the healthcare services, because not everyone is bad and treating people bad. As Sister Nkosi, I hope you will take care. People from Department of Health, please send our gratitude to her and say thank you for taking care of patients and listening to them, making sure that they get services as they are required. And that is kind of an attitude that we need, and services from sisters, from the nurses. We really appreciate nurses like that. We know that there are a lot of them. It's just that they are clouded by those who are not doing very well. But yeah, we really acknowledge those nurses and sisters and doctors who are doing well and making sure that they are taking care of our communities and families. On this TP case, I just want to say it's just we are not just monitoring and we leave it like that. We also do advocacy, although we don't encourage fighting and putting phones down and commotion and all those things that happens. But at some point, you need to push it hard for other people to understand what you're saying. But advocacy, it's what we always do. And when we do advocacy, it's not because we are anti the department, but we want things to be done right. So I'm happy that the other lady went out of the clinic in Evosho, because you can tell when you get the treatment right, it's easy for you to go home happy, and it's easier also for a patient to come back home, come back to the facility for more services. So all of us, we want to go home, sishaye ivosho angithi masiphume kuma facilities, and we are hoping ukuthi through the NHI that we are now excited and talking about it, we'll get there slowly kancane kancane sizofika. Recommendations, the Department of Health should ensure Department of Health staff acknowledge that it's normal to miss appointments and or have treatment interruptions. People living with HIV returning to care after late missed scheduled visit, silent transfer from another facility or treatment interruption should be welcome. Ensure Department of Health staff treat people in dignified and friendly manner, and investigate any reports of poor attitude raised by Ritshidze and take disciplinary action where appropriate. So that is uphuma ngevosho. Send communication to all send communication to all sites highlighting that no people living with HIV should be sent to the back of the queue if they miss appointment, as per welcome back strategy that says people returning to care should be triaged. Ensure transfer letters are not to be required for ARV continuation or restart. Any reports where treatment is delayed by requirement or transfer letter should be urgently investigated and disciplinary action taken where appropriate. The Department of Health and Outreach should implement 2023 adherence guidelines standard operation procedures with fidelity, including ensuring every person starting ART is provided with good quality, fast, quick initiation counseling session 1 at ART start and second and session second after 1 month ART. Taking first viral load as early as early as possible to ensure providing earlier adherence intervention support and earlier access to longer treatment supply at more convenient location. Actioning an evaluated viral load without delay, including funding and setting up effective abnormal result recall systems, and providing quality enhanced adherence counseling when appropriate. Actioning a suppressed viral load without delay, focusing on immediate assessment, offer and enrollment into the repeat prescription collection strategy of choice the month after viral load taken. All facilities implement 2023 re-engagement algorithm, including appropriate differentiating services for returning people living with HIV. Ensure Department of Health and Broadreach staff provide accurate and easily understandable information on treatment literacy and adherence, and the importance of an undetectable viral load through consultation, counseling, and outreach. Ensure that treatment literacy information is provided at health talks each day at the clinic. Ensure that Department of Health and Broadreach staff explain viral load test results to all people living with HIV properly in timely manner. Broadreach should ensure Broadreach staff acknowledge that it is normal to miss appointments or to have treatment interruptions. People living with HIV returning to care, a late missed scheduled visit after transfer from another facility or treatment interruption should be welcomed. Ensure Broadreach staff that treat people in dignified and friendly manner and investigate any reports of poor attitude raised by Ritshidze and take disciplinary action where appropriate. Support the training and mentoring of Department of Health staff at facility level on the revised 2023 re-engagement clinical and adherence guidelines, SOPs. PEPFAR should fund an expansion of people living with HIV and key population-led treatment literacy efforts across all provinces through training, education, and localized social mobilization campaigns. Now the next group of issues will be on key populations, which will be led by Comrade James.
Thank you so much, Chair. Public health facilities are the entry point for many key populations into the health system. Therefore, it is critical to ensure a friendly, respectful, safe, and confidential environment for all, with services that cater to key population-specific needs. Yet, despite sensitization training and retraining efforts, disrespect, ill treatment, and dehumanization of key population remain a widespread challenge. Key populations who are treated badly, humiliated, fear for their safety, or even refused entry will inevitably not come back to the facility. Ritshidze data reveal that at public health facilities, only 32% of gay, bisexual, and other men will have sex with men, 27% of people who use drugs, and 62% of sex workers reported staff are always friendly and professional. Where the attitudes of clinic staff have become unbearable, some people have stopped going to the facility altogether, including for HIV, TB, and STI testing and treatment. Disgracefully, privacy violation continue to occur that destroy people's right to privacy and make clinics feel unsafe and uncomfortable to be in. This year, 36% of gay, bisexual, and men who have sex with men, 44% of people who use drugs, and 21% of sex workers did not think privacy is well respected in clinics in the district. Please note that given our small sample size for trans interviews, we have excluded trans data from some of this section. Shockingly, significant numbers of key populations reported being refused access to services in the last year because of being someone who uses drugs, is a sex worker, or is part of the LGBTQIA+ community, including 8% of gay, bisexual, and other men who have sex with men, 33% of people who use drugs, and 11% of sex workers we interviewed. This is absolutely unacceptable and goes against Section 27 of the Constitution. Where key populations do continue to suffer the daily indignities of using the public healthcare system, specific services remain unavailable for the most part. Ritshidze data reveals that a low proportion of facilities provide services for key population when asked generally. Just 17% of facilities reported providing services for gay, bisexual, and men who have sex with men. Just 11% for people who use drugs. just 17% for sex workers, and just 17% for trans people. 14 of the facilities monitored in the district did not report offering any services for any key population group. Out of the 18 facility responses, only 2 of them reported offering PEP for gay, bisexual, and other men who have sex with men, and only 1 facility had outreach services. For people who use drugs, out of the 18 facility responses, no facilities reported offering referral for methadone initiation, and only 1 facility said they had friendly HIV testing and counseling for people who use drugs. Out of the 18 facility responses, only 1 facility reported offering sex worker friendly STI screening, and only 2 facilities reported offering gender-based violence services for sex workers. Again, out of the 18 facility responses, no facilities reported offering referral for hormonal therapy, and only 1 facility reported offering psychosocial support for trans people. Key populations can't always access basic prevention tools like condoms and especially lubricants. Lubricants, for example, are only freely available in 33% of facilities monitored. And in those sites, too often the lubricants are put in spaces where staff and community members can see you as you collect them. Only 38% of gay, bisexual, and other men who have sex with men we interviewed, 63% of people who use drugs, and 74% of sex workers using public healthcare facilities said they could access lubricants. Yet, far fewer said the staff were respectful when they tried to access them, or that they can get enough. Comrades here today, please put your hands up if you can regularly find lubricants in your clinic. That's the reality, no one. While 81% of sites monitored say they have lubricants available for HIV prevention, not everyone can access this basic commodity in the clinics. Not all facilities prioritize offering key populations PrEP, despite it being available in 100% of sites monitored by Ritshidze. While covering a wider and differing set of sites, only 8% of gay, bisexual, and men who have sex with men, 5% of people who use drugs, and 33% of sex workers interviewed reported being offered PrEP at the facility, pointing to the reality that while PrEP is sitting in facilities, key populations are not always made aware of and actually offered PrEP. Widespread access to harm reduction services remain outside the reach of most of the people they are meant to serve. Those who have tried to access harm reduction services are often left without services or any information on where they could get them. Only 5% of people who use drugs were offered information about where they could get new needles. Only 7% were given information on where they could get methadone, and only 28% were able to access drug dependency support. Service accessibility must be improved to ensure that people who use drugs' needs are met and no additional barriers are created to be able to take drugs safely or supported to stop. It is positive that PEPFAR and the department has committed to establish 1 center of excellence per district. However, 1 site is just not enough in districts that are very vast. And these sites will not be providing a full package of services. We urge the department and PEPFAR to at least establish 2 sites per population group per district, where a minimum package of KP-specific services are made available, and where facilities are highly sensitized to the needs of key population and provide friendly, safe, and confidential services. Now we move to our recorded stories.
Ngihlala eMelo ngi-sex worker. Nginkinga clinic iTBK nase eMelo public clinic. Ngithatha treatment ye-HIV. So last year, November, i-TBK yeza. Yafika nika amapilisi we 1 month kuphela. And ngoDecember bayavala. But bazobuya ngoJanuary. January, makumele ukuthi babuye azange babuye. Ngahamba simple treatment, ngahamba ngaya le-MLO public clinic. Mangafika lapha, bathi bafuna i-transfer from what-TBK. So ngabatshela ukuthi no, angeke ngikwazi ukuyithola because labantu laba bathatha isikhathi since ngibagcine last year ngoNovember. So njengoba ngila simple treatment, bathi angeke nabo bakwazi ukungisiza, kumele ngize nale transfer letter. Ngicela ukuthi bangiphe at least iphakethe le 1 month for time being ngisalinde la ngi-TBK. Bathi ngeke baze ukungisiza, zange banginikeze vele lutho. I-treatment ngiyayicela like ebanganini. Umuntu ongisiza kakhulu i-boyfriend nami because naye i-HIV. So yena maka e-clinic mhlawumbe bamnikeza amapilisi we 3 months. Uyakhona ukuthi anginikeze le phakethe eyi-1. But manje sekuba inkinga because ini bamtshintshile. And nami ngiphuza amapilisi angazi nokuthi la mapilisi angaphuzayo ayasebenza or awasebenzi. Because angithathi magazi, angenzi niks. Just nje ngiyaphuza kuphela. E-clinic vele bathatha advantage for umsebenzi engiwenzayo ngoba ngi-sex worker. I-TBK like akekho ema-clinic bayazi ukuthi i-clinic esebenza ngathi. But then kungiphatha kabuhlungu ukuthi why just because of ngisebenza nomsebenzi angikhona ukuthola usizo. Kubuhlungu serious. So makenzeka maybe ngibe ne-STI. Ngibona ukuthi kungcono ukuthi ngikhiphe imali ngizile ka-doctor than ukuthi ngiba inhlekisa e-clinic. So yeah, it's either ngeka-doctor or nge-chemist. Ngingajabula if thina ama-sex worker bangasitreat-a as abantu abanormal abafana nabo. Bayekele ukusithatha as if singabantu esingaphili, singabantu nathi. Imisebenzi ayikho. So nathi sizama ukuzenzela something for you. So mabangasithathi njengabanye abantu basiphe i-treatment le abapha abanye abantu. Ngajabula.
Ngihlala e-MLO, ngahamba ngaya e-MLO clinic, ngofuna usizo ngoba ngangigula ngiphethe operation. Kwakubanda kukwara to 12 ngoNovember 2022. Bangijikisa bathi ngifike sekulethi angobuya ngakusasa. Akungiphathanga kahle lokho ngoba ngangigula vele umthungu uyangihlupha vele makubanda. Ngizange ngisabuyela ngahamba ngadokotela ngifuna amapilisi. Bayangisiza kwi-mobile mabefikile. Uyayeza na ngisazi last week kodwa bikhona. Ngolesine ngoLwesithathu bekade khona. Mina njengoba ngi-sex worker ngicabela ukusebenzisa i-mobile ngoba iyona ekhona ukungisiza e-clinic abakhona ukusisiza. Ngosizo ukuthi mhlambe njengoba sisebenza lo msebenzi bakhona bayaqhuma, bayakhona usinikeza amapilisi okuklina ku-mobile. Bakhona ukusinaka ku-mobile.
And i-clinic nokwenza after pill. Angikwenze ukudaba i-condom. Bese ngithola inkinga yokudaba usister labana ungithithisa ukuthi kanti umsebenzi wami angiwazi. Okunye futhi mangilanda i-treatment bangitshela ukuthi futhi ubuye ngani. Ukuduba kwami nge-clinic azange sayi-attend amaphilisi ngihambe ngiclinik. Ngithatha yona i-treatment yama-ARVs khona leSeattle. Angeke ngazi ukuthi bazongiphatha kanjani ngoba vele angisayi. Noma ngifebruary ngiwacelela ebanganini ukuthi badla maphi. Nami sengiyaphuza ngoba nami angiwathuli ukuthi ngiyahlukumezeka vele e-clinic.
Sanibonani.
Greetings.
Mina bengithatha i-treatment from a Deep Kloof clinic eSoweto.
I was collecting my treatment in Deep Kloof clinic in Soweto.
And then ngeza this side eMbalehle.
Then I relocated to Mbalenhle.
Manye clinic extension 14.
When I went to the clinic in extension 14,
ngafike ngacela amanesi ukuthi ngicela i-medication because le ngichamuke nayo sengiphelele.
when I ran out of medication, I went to the extension 14 clinic and I requested ARVs because I ran out of ARVs.
Unesi lapha wangitshela ukuthi angeke akhona ukungisiza nge-medication yami because of angina transfer letter.
I was told I'll not get medication because I did not have a transfer letter.
So after a month, since bengize nomntwana this side, umntwana wagula wangabi right vele siso sakhe sa raise.
After 1 month, my child was not feeling well.
And then ngaye clinic, mangifike clinic usister oyi-1 ngale ebantwaneni udila ngabantwana wacheck umntwana wabona ukuthi akekho right.
They attended to my child and realized that my child was not well.
Wabiza amanye ama-sister wathi yeah ugulisa lo mntwana that is why siso sakhe se-raisile because of ngoba uthatha treatment yakho.
And the nurse that was attending to me then called in other nurses and they said, my child is sick and I'm the cause because I'm not taking my treatment.
Ngamcela ngathi sister ngoba ngacela last the time ngize lana ngithi ngicela treatment wena uzangisiza bekumele ngenze njani. And umntwana mabacheka igazi lakhe bathola ukuthi u-right yimi just ngine problem.
I did explain to the nurse that I was there last month and I requested that you give me ARVs and you did not give me, so what did you expect me to do? And then they tested my child for HIV and they found out she was negative.
So after lapho babizana bangihleka bathi ya yimi ngiguliso umntwana so angeke bangisize. Mina ngibuyele back at the Kloof clinic le bengithatha khona medication ngithola transfer letter.
And they were calling each other and making remarks about me and told me they're not going to help me. I must go back to Diepkloof and get a transfer letter.
Angikhona ukuya Diepkloof because of imali engisebenzayo incane ene mangimcela i-medication yena uhlekisa ngami. So decide ukuthi ngcono ngingasayi clinic because ngoba sebahlekisa ngami till today.
I cannot go back to Diepkloof clinic because where I'm working I'm not earning much. And when I asked for medication, they are making me a laughing stock. So I stopped taking treatment.
Till today, anginayo treatment. Angithola usizo. Ngicela umuntu abantu ukuthi bangiphuzise medication every day.
Till today, I only get treatment from friends on a daily basis. I do not have treatment. Thank you.
Dumela.
Greetings.
Nna ngile ka ya lefehlong ga le kwa ka lo thwasa ka be ke ya clinic ke kentse lenyetse hlong hanga ba ka thola ntho e ntle ha ba tsanga ba ntshwara ha mna ke sister mo ba ke kentse lenyetse ke a anka a ditsa ma sister ma ba ngapella ba re honna ba ntshwara le botloho.
So I'm on ARV treatment and then some time back I went to initiation school for traditional healing, and after that I went back to the clinic, but I was wearing my beads from the initiation school, but the nurses did not treat me well. She called in another nurses and they started praying for me.
Ne bang rapella ba ntse ba mpusha ntse ba re phuma matimone fire ka re ba batla re kiwe.
And they were praying for me and they kept on touching my head to say the evil spirit must come out of me.
Nto a ka ba ntshwara mnate ka ba ke le ba se ke tloa ke sna matla o ya clinic ne ke dula ke roma ngwana e so ga latele treatment.
Since then, I didn't have any energy to go back to the clinic. I normally ask my younger sister to go and collect my treatment.
Nna ntho ke la ka tsang di clinicing ko hore batho re le batho ditumelo tsa rona ha di tshwane.
So I wish that the nurses in the clinic can understand that as people, our beliefs are not the same.
Ba amohele se re leng sona ha re tshwane modimo ha re fa ka o tshwane motho mo le mong o na le ntho e le tumelo a dumelang ha ba re tshwareng ka o tshwane.
They need to treat us equally irrespective of our beliefs.
Sanibona.
Greetings.
Njani?
Siyaphila.
Siyaphila. Angengizisho igama kodwa ngibuya eBethel.
I'm from Bethel.
Ngihamba town clinic.
I attend a town clinic.
Kwaye kwenzeka ukuthi ngilanda khona treatment.
I collect my treatment there.
So ngesinye isikhathi kwenzeka ukuthi ngaze ngaba nelamp.
I had a lump.
Bangithumela esibhedlela.
They transferred me to the hospital.
Mabengithumela esibhedlela ama-doctors ayeshoda.
When I went to the hospital, there were no enough doctors.
So kwamele ngibuyele eclinic la ngiqhamuka khona.
Then I was transferred back to the clinic.
For about a month.
For a month.
Lokhu ngenza up and down.
I was sent back from the clinic to the hospital.
So kwagcina sekuthiwa sekumele ngibukhelwe for operation.
Then they ended up saying I had to be booked for operation.
The operation yazibukwa mhlambe after 2 months.
Then I was also only booked for operation after 2 months.
So kwatholakala ukuthi mangiceda yona ngibuyela eclinic.
And then after the operation in the hospital, I was then referred back to the clinic.
Eclinic kodwa sitreateke kahle.
But at the clinic, the treatment is not good.
Because ngathi kune staff shortage.
It seems as if there's no enough staff.
I-treatment bakunikeza e-reception.
Our treatment have been handed over to us at the reception.
So enenye into iqiniso ukuthi vele bayabizana ngesinye isikhathi.
It is true that the nurses call each other.
Now uthi uyafika unenkinga like maybe sibuzongizwisa nangoke.
So when you arrive at the clinic and you try to explain your problem, the nurse will call onto another nurse to come through and hear.
Ne-privacy ayikho.
And there is no privacy.
Yabo.
Thank you.
Sanibonani.
Greetings.
Ngibuye eBhetali ngokuhlala.
I'm from Bethel.
Ngisebenzisa iklinik yaseBhetali ibizwa ngeSiat Clinic.
I use Siat Clinic based in Bethel.
Kanti futhi ngiphila nesifo lesi sandulela ngqulaza.
I'm a person living with HIV.
Ngithatha khona i-treatment lapha eSiat Clinic. Bengithi mangiya khona ngifike ngibaqhazela inkinga yami yokuthi i-treatment bekade ngiyiphuza bengangiphathi kahle.
I also collect my ARVs at Bethel Clinic, and when I go there, I explain that the treatment that I'm not taking, it's giving me problems.
Ngikhumbula ilanga engafika ngalo last year November ngifike ngibachazela futhi ekubeni bekaningi ngibachazela ngibathola bawu3 egumbini.
I went there in November last year and I explained again my problem, and there were 3 nurses in the room.
Ngalibeka udaba lami bavedane bachwebana bodwa bakhuluma lapha bathi ayinalo ke le gate elicalile kahle kahle lifuna ukusiphatha.
I explained my issue again, but they just talked among themselves and say, oh, this gay has started again.
Baqhubeka nangalelo langa banginika i-treatment wrong ngahamba ngayekhaya.
That day again, they gave me the treatment and I went back home.
Kwafika idate enye ngabuyela eclinic ngathola umunye usister ngingasathola la bengabathola that day. Ngafike ngambikela udaba lwami wangisiza kakhulu sister wangishintsha washo vele naye ukuthi the treatment beyi wrong cause beyimosha ama kidney.
On my following appointment, I went back to the clinic again, and at this time I found a different nurse, and I explained again my challenge with the treatment that I was taking, and the nurse this time assisted me and said this treatment was not good for my kidneys, and then my treatment was changed.
Yebo kodwa kuhle ukuthi manje sengiright sengipholile bekade kuyisifiso sami ukuthi ngiyafisa ukuthi abezempilo engathi bangabafundisa ngokugcwele awonesi ngathi thina abantu abaphila ku-LGBTI cause ngayifila kwangathi kwamina banenkinga ngendlela engiphila ngayo indlela ababehave ngakhona.
Okay, so I'm happy now that I'm healthy and I'm well, but my wish is that nurses at the clinic can be informed or educated about the LGBTI communities, because the way they were treating me, I felt as if they had a problem of the way that I live. Thank you.
Sanibonani.
Greetings.
Ngwasefeni, ngihlala eFeni 2.
I'm from Feni.
Inkinga engike ngahlangana nayo ukungatholi i-treatment yami bengithatha i-prep before.
I went to Feni and I could not get my prep.
So bangitshela ukuthi ngathi mangifika ngizofuna i-prep bathi ngize bakhona ukunginikeza because i-ID yami inqamukile.
When I went and requested for the prep that I was taking, they told me they won't give me the prep because my ID document was torn.
Ngazama ukubatshela ukuthi ngizoyibiza i-ID because ngiyayazi ngekhanda ba refuse ukuthi bangikhiphele i-file ngithole nenakhuzana i-treatment yami.
I tried to explain that I do know my ID number so that I can get the prep, but they said no, they will not help me.
Okunye ke efeni asiwathole ama-replicant enough because I-deliver i-Anova Health kuphela, so singamagay asiwathola ama-lubricants and condom enough because makuphela lawa awe-Anova asiwatholi amanye. And okunye ayikho indawo lesingafike siwathenge khona, azikho indawo esingathenga khona ama-lubricants.
So another problem is that in Feni, as gay community, we do not have enough lubricant. There's either no place where we can buy them. Anova do come and deliver, but they don't bring enough. So we always have a shortage of lubricant.
Sanibonani. Ninjani?
Greetings.
Siyaphila. So bengiye kwi-clinic le eMncindi.
I went to Ehlanzeni clinic.
Bengini STI.
I had an STI.
So ngangena kwi-consultation room.
I went into the consultation room.
Bekunamanye ama-patient.
There were other patients.
So I think eMncindi bebagijimisa isikhathi ngakho bese bangifaka namanye ama-patient.
I think and mentally they were trying to save time, so they put me in a consulting room where there were other people.
So now as mina MSM,
As an MSM person,
I didn't feel comfortable.
I was not comfortable
Ukuthi ngimkhombe usister lo yakuthi inkinga yami kuphi.
to explain and show the nurse what was my problem.
So ngagcina sengiphumile azange ngilithole usizo.
I just left the consulting room without getting any help.
Since from there it's 2 years back azange ngiphinde ngibuyele eMncindi.
This happened 2 years back, and since then I never went back to the clinic.
So bengiya kadokotela I use approximately like 400 rand.
Then from then I go to the doctor when I have a problem, and I spend about 400 rands.
And ngiphinde ngisizwe na Anova Health.
And sometimes I get help from Anova.
Thank you.
Sanibonani.
Greetings.
Igama lami uSiphamandla. Ngala Emelo, ngiye ngaba nenkinga. Ngiyo-attenda eMncindi. Bengiyo-checka ama-results wami.
I had a problem when I went to Ehlanzeni clinic to get my results.
Ngathi mangifika on that day, unesi owayezongi-attenda.
When I arrived on the day, the nurse that was attending to me,
wangibingelela, then wathi sisi, and ezangibuka kahle wangibuza ukuthi ungisesi vele, and I had to explain ukuthi no, actually I'm gay, and wafuna vele explaining ngimchazisele ukuthi what kind and type of gay I am. So I had to explain everything, and as I was explaining what to stop.
So the nurse that was attending to me came and greeted me as a sister. And she then asked me, actually, are you actually a sister, a lady? And I said, no, I'm gay. And she asked me what kind of a gay I am. Then I sat there and I had to explain myself. And then as I was explaining, she said I should stop explaining.
And then wasukuma wabiza omunye unesi.
And then she went to call in another nurse.
As abiza omunye unesi, umtshela ukuthi akeze azozwa lento ayizwa la phakathi bangena, and I had to explain further again. And as I was explaining, they were laughing. So I felt discriminated as bangenza laughing stop.
So she called in another nurse to come and hear what I was saying, and she came in and I explained, I continued explaining, but as I was explaining, they were laughing. And in the process, I felt bad, I felt discriminated as they were making me a laughing stock.
So ngahamba kanjalo ke, I never went back to the clinic in a period of 2 to 3 months until I was introduced to Anova Health. Then from there, I never stopped to go to clinic, attender, everything. Thank you.
And since then, I stopped taking my treatment. I stopped going to the clinic for about 3 months until I met people from Anova who assisted me to get my treatment.
Sanibonani.
Greetings.
Kulama vika phelile bengisekhaya bengishonelwe Feni.
In the past few weeks, I was home in Feni. We had a bereavement.
Only to find out ukuthi ngihambe ngithe mangisuka la eMelo bengigula bengine STI.
I had an STI.
Then ngaya eFeni 2 clinic.
I went to Feni 2 clinic.
Mangifika eFeni 2 ngangena ku consultation room with usister lo wayekhona leso sikhathi.
I went into the consultation room where there was a nurse.
Then mangimtshela ukuthi yazi ngiyagula ngobhlungu la ngemuva angazi ukuthi kwenzakalani.
I explained to the nurse that I was not feeling well. I had a pain at my back.
Then waqala yena wangishumayeza ngokuthi uyazi ukuthi if wenza anal sex and kunama complications nje okay lokho it was fine wasungitshela ukuthi but you can even refer kwabanye abadala kunawe kudala abaqala bama-gay ukuthi ekugcineni bagcina kungesana ama-break and everything and lento esiyenzayo ayikho right ukuthi because anal was not meant to be fucked. Wakhuluma nje izinto eziningi. Then
okay, so the nurse, after I had explained that I had a problem at my anal, she started telling me the implication of having anal sex. I was okay with that as she was giving me information, but then she went on and on telling me how bad anal sex it is, because at the end of the day, I'll end up being unable to control myself.
Then ekugcineni wavele wanginikeza amaphilisi kuphela angawachazanga wavele wabhala wanginikeza amaphilisi. Ngahamba ngaye ekhaya the following day ngadrive ngeze Emelo ngazo consult udoctor. Then udoctor azange afika nginikeza yonke angibuza wonke lama questions kanjani. That nurse, she even refused to examine because mina ngamcela ngathi ngicela ungi-examine ubone ukuthi kwenzakalani. She refused ukuthi ang-examine, but udoctor wafika ngathi mangimtshela istory sami wathi uright ukuthi ngingakhona ukuthi ngikucheck-e ngi-examine ngicela ukugibela embhedeni. Then ngagibelwa ngi-examine after that wangijova ngaba right.
Okay, so in the process during the consultation with the nurse, I had asked her to examine me, but she refused to examine. She just handed me medication. She did not even explain how I took I need to take the medication. She just wrote over the medication and handed over to me. The following day when I got back to Emelo, I went to a private doctor, and the private doctor, after explaining my story, he made me sit at the bed and I was examined, then I was given medication.
So engizocela from the Department of Health njengoba ikhona ngaphakathi kwethu ngisacela ukuthi kube khona maybe ama training kuma nurse wonke around Gert Sibande afundiswe about ukuthi actually LGBTQIA+ ukuthi mawafikile angazi singatreatwa unique but kube ne information babe more babe ne-information eningi ukuthi like lokhu makwenzeka so bakwazi ukuyishare to kwamanye ama-MSM afikile ngaleso sikhathi mawasuka kugula because it seems as if mawufika from the facility to MSM they don't take you serious and at the same time it's like they don't even know ukuthi bazocala ngokuthini bakhulume nawe.
Okay, so my request to the Department of Health in the house is that they need to sensitize the nurses in Gert Sibande to be informed about the LGBTI community and how they should treat them when they arrive in the clinic. We're not saying as LGBTI community we need to be treated special, but the nurses need to be informed also of the kind of illnesses and how they should approach us. Thank you.
Sanibonani.
Greetings.
Ngayekela ukuhamba eclinic eMncindi
I stopped attending Ehlanzeni clinic
because I'm a transgender person.
Because I'm a transgender person.
So every time mangifika clinic kumele ngibaqhazele what is a transgender.
Every time when I go to the clinic, I have to explain myself, explain what is a transgender.
From the security to the administrators namanes.
I have to start explaining from the security, going to the administrators, then to the nurses.
After explaining, bazo comment or bazo solok bangbuza my questions are very uncomfortable.
After I had explained myself, they will continue making comments and also asking me questions, which makes me very uncomfortable.
And ogunye, I stopped going to the clinic because abasi pitina hormonal therapy.
And also I stopped going to the clinic because I'm not getting my hormonal therapy. We ended up buying from back doors.
Or doctor's prescription, pharmacist.
Or you need to get a doctor's prescription to get them from a pharmacy. Thank you.
Good day to everyone. I'm from Standard Horn. The clinic that I went to, it is Mpumalanga Clinic.
I'm from Standerton and I use Mpumalanga Clinic.
The issue that I had, I went there with my research on hormonal therapy as a trans woman. So I went there like actually they opened a file for me and then I waited on the queue for like an hour. Because like they take a very long time to attend patients, no matter ukula kangakanani. Bathatha nje isikhathi sabo. And then I was directed to like this thing, to a nurse though. And then I explained, I want to start my hormonal therapy. She was clueless. And to my surprise, I was like, I didn't understand, Guti, you're a nurse, you don't know what a trans woman is. Like, I just didn't understand, I was so lost. I had to explain, Guti, imagine having to explain for someone who studied to do what she's doing. So I had to explain myself, Guti, I want to study hormonal therapy, and I had to explain to her what is hormonal therapy, you know? So after explaining to her, she confirmed, Guti, we do have like that medication, but we won't help you because asazi how to help you, you know? I don't know that, but we do have that medication and stuff. So I was very disappointed with that. Currently, like, I buy my medication, of which it's very expensive. Yeah, that's the issue I had with the clinic. Thank you.
Trans woman ngiye eStanderton clinic after ngiyenza research about hormonal therapy. Mangifika eStanderton ngalandela wonke ama-processes indlela. Ama-processes wakhona until ngaze ngangena eroomini la ngihlangane khona nonesi ngamchazela ukuthi ngize lana ukuzothola hormonal therapy angiyazi ngesizulu. Unesi wangibuza ukuthi yini lokho, then ngamchazela wangitshela ukuthi hayi ngathi sinayo i-treatment enjalo but angeke sikhona ukukunika because angiyazi ukuthi administer kanjani. From there, bengimangele kakhulu ukuthi how come unesi angayazi le treatment, unesi angazi anything about trans people. And then I ended up ngiphuma ku facility ngingancedwanga. Currently ngiyayithenga treatment and iyabiza. That's about it.
Sanibonani. Mina ngihamba town clinic la Emelo.
I use town clinic in Emelo.
So nami ngafika ngizofuna like ama hormonal therapy. Then ngathola unesi. Hawu mangifika unesi. La ngimtshele isinto sami hayi nesi ngizelana for my hormonal therapy. Yabo okay aso nesi. Uzokwenzani? Hayi lokho asinako la. Kwakade nje yini utshintshelani ngoba ungumfana omuhle kabi wena. Yabona angitshela amagama abhlungu like why nichinja vele. Yabona I feel like ngavele ngaba nganyanya vele ngaphuma same time azange ngiphinde ngibuyele vele till today.
So I went to Emelo clinic to get hormonal therapy, and when I went into the consulting room, I explained to the nurse the reason I was there, and she said, "What is that? We don't have that. Besides that, why did you change? Because you are a beautiful boy, handsome boy. Why do you change yourself?" And she kept on talking, and I was not interested. I got very angry and I just left the facility. And since then, I never went back to the facility.
Sanibonani. Ninjani. I'm from Standerton. I'm also a transgender woman. So I went to Mpumalanga clinic. I was sick. So mangifika lapha eMpumalanga clinic, and then baqale bangivulele file because I didn't have a file. Bangivulele file, they took my ID and everything. So it was time ukuthi ngiyobona udoctor. Okay. Udoctor at the time like bengiselayinini for EQ, you're going to file like beangibuka like more like flirting with me. Okay. So it's my turn ukuthi ngiyongena like ngiyobona udoctor, and udoctor sayaphethe file lami manje uphethe file lami and just expect mina ngene ke emnyango. Mangena udoctor was shocked, like angibuza ukuthi is this the real you, like your name, like your gender and everything, nguwe lo? And I was like, yes, this is my file. So I started explaining ukuthi okay, what is going on with you? So I told the doctor, like, I'm like, so doctor azange angicheke. The doctor was like, rush, ngathi bangafuni ukungifacea. Now, masoyitu, like, agurashi, wangibuza ama symptoms and then wanginiki medication. I was like, angeke ungicheke ukuthi like kwenzalani, because now I don't know what's happening. So check-out udoctor wathi sekuyavalwa ekliniki. I should just take my lezinto anginika zona. I didn't even spend 5 minutes bese ngiyahamba. Mangihamba athi mara izinto enzenzayo. Okay, hi, ngiphume disappointed. Then ngaya endlini. So I came back again like recently, I think a month ago. Ngaya eMpumalanga clinic because I had flu. Oh, okay. Ngibona amanesi. Amanesi, okay, they were like, their approach was a little bit friendly because, but waqala wangibuza ukuthi like, why are you having like amagama abafana but you are a woman? I was like, no, I'm a transgender woman. Oh, I want compliment again, whatnot. Koba right, bang check and everything, HIV and AIDS and everything, like bang check and then bang a proper medication. So, but mang like in mixify lami a front, mang figure a fronty, il mixify lam, mang il mixify lami. There was a person I LGBTI, but he's just gay. Okay, if I lami like lingathatha umuntu lapha, baloke athumele omunye guy or straight ukuthi abheke file lami. kube nguyothatha ifile lami alithathe ukhaya ifile lami athuke kusale vele kukhulunywa ngami kuhlekwa like ngaphuma ngahamba. That's what happened. So angisathanda ukuya ema-clinic because number one, you have to show your ID. I haven't changed my ID. Number one, I haven't changed it. So bazoloku bakubukisana nge-ID yakho bakuhleka bakubuka in a certain way. So it's better ukuthi manje usizo ngilithola from Seed of Hope. Ngiyabonga.
Okay. Briefly, Uti, I'm a trans woman. I went to the clinic. I was Mpumalanga clinic. I was not feeling well. I was attended by a doctor who did not even want to look at me. He did not even examine me. It felt like the doctor didn't want to be in the same room with me. He just handed over my medication to me, and then I went home with that medication to drink. And then a few weeks back, I felt sick again. I had flu. I went to the clinic in, what's the next clinic? Mpumalanga again. I had flu. This time I was treated well. The nurses attended to me. But when it was time for me to leave, I had to take my file to the reception desk. They did not want to take my file. They were looking at my file, laughing at my name. I do not feel comfortable lately to go to the clinic because as a trans woman, I've got a name that's apparently meant for men. And every time they'll be taking my ID around, talking about me, making me a laughing stock, to say I've got a male name and I look like a woman. So I'm not very comfortable. As a result, I'm no longer going to the clinic. I use private.
Sanibonani.
Greetings.
Ninjani? Saphini. Ngumuntu ethatha amaphilisi.
Hi, I'm on ARVs.
Yes, ngeyi-6 ngabe ngicala iclinic yase ngeyi-6 bengicala iclinic yase Ritshidze and then bengisuka eMpumalanga.
I relocated from Mpumalanga to Ritshidze.
Yes, ngeyi-6 April bengise Ritshidze ngiphethe i-referral letter ngiyocela ukuvula ifile khona ngithatha i-treatment emva kokuthi sengimuvile eMpumalanga ngizohlala ngapha ngase Ritshidze.
So after relocating from Mpumalanga to Ritshidze, I went to the clinic on the 6th of June with my transfer letter to open a file.
Basinkinga ukuthi beyisefonini kwaba khona inkinga ukuthi abakhona ukuthi bangiprinted out so bazongi-emailela and then ngathi akunankinga bayi-emaila ngahamba nayo and then mangifika lapha eclinic eTrishard ngathola omunye usister oyi-1 and then ngambuza ukuthi wangibuza ukuthi ngizoyenzani into yokuqala ngathi mangiqala ngivula umlomo ngimbingelela waba shocked like.
So the problem is that at the Mpumalanga clinic, they said they couldn't print my transfer letter, so they sent it to me through email, which I took with to the clinic on the 6th. Then when I arrived at Ritshidze clinic with my transfer letter, which was on my phone, and I greeted the nurse at the consulting room, but then she gave a facial expression that she was shocked.
Wangibuza wathi unentshebe mara ukhuluma njengentombazana and then it's when ngaqala khona ngibona ukuthi I'm shooting into them right because into yokuqala sekayangiceka.
And the nurse said to me, you have BS, but your voice sounds like you are a lady. And it's from then when I realized that I won't be comfortable here because I'm being discriminated already.
Okay, wangabi nesikhathi sami waba nesiphithiphithi nje sokuthi unebhizi wangimisa ekhoneni so wathi ucela ukuthi ngilinde lapha kancane so ngizobona umphathi clinic wase Ritshidze.
So the nurse didn't give me much attention. She asked me to wait so that I can see the sister in charge.
Semakusuka lapho ngiyabeza bakhomba lapha admin and then ngiseduza nasesekuteni bakhuluma ngami ukuthi ngizenza ngathi ngifundile angiphathi abangibuza nongibuza angiphathi referral letter ngiphatha ngefoni ngifundile kanti ayingahambe ngiyothenga medication ngihlula abafazi ngijimana namadoda ekugcineni sengiyagula manje ngizonyefezela bona abakhulumi nami phela thambathi ngiyabezwa.
But then I was sitting next to the reception where I overheard the nurse with the other staff talking about me to say I'm pretending as if I'm too educated because I didn't bring the hard copy of the transfer letter. I have the transfer letter on the phone. If I'm educated, why am I not going to the private pharmacy to buy my medication?
Ngahlala lapha eTishati ngo-6 ekuseni until ngo-4 banganginaki lokhu bangimise lapha ekhoneni.
I stayed at the clinic from around 6 to until 4.
Ngangabi nenkinga ngajika and then mase bavala ngaphuma ngayijikela ngazabuza secretary bakusizile ngathi cha. Ngajika ngahamba ngayenza ishow ukuthi ngiprinta out i-referral letter kanje ngibuya nayo the following day again.
I was not assisted on the day. I left the clinic and somebody asked me if I was assisted. I said no. On my way home, I made sure that I print out the referral letter and went back to the clinic with the hard copy this time.
Sese ngibuyela ngathola omunye sister futhi.
When I went back, I met with a different nurse.
Ngamtshela ngathi ngizocala iclinic at the site ngamtshela story sami from the start ukuthi and then into ebengayiphisanga ngizole referral letter and they be say phoning so manje isikhona so ngizocela uqala treatment the site.
Then I explained my story to the nurse that I was here yesterday, just that I didn't have the hard copy of the transfer letter. So today I'm here with the hard copy. I would love to open a file and get my treatment from this clinic.
But still wathi ngime la ngime khona izolo. Amshithi bebathandile. Ngaphinde ngiyema before ngizoma ngambuza ngathi ngiphuze iphilisi lokugcina ndi treatment yami isiphelile. So ngizoyenza njani? Ngizosizakala noma cha?
Before she could assist me, she said I should wait. But then I said to her that this morning I took my last pill. Are you going to help me today or what? Because I don't have treatment anymore.
What I sizokusiza okay ngema lapha yana ekhoneni.
And she said, no, we'll help you, just wait.
Kwaphinda futhi kwashaya ifoko kwavalwa and then they told me ukuthi imanager ayisekho ihambile. At the same time bangitshela ukuthi ya bona banasikhathi sokusizwa ama-twin plug because sisigijimisa amadoda amantombazana khona. And then ngaphuma ngiphukile emoyeni and azange bazi banginikeza leyo treatment and then I have to go back to Mpumalanga ePolinamra Pedisweni ngathola khona treatment from 6 April up until 19 May uyakwami Mpumalanga, which means from all those days bengayiphuza treatment.
So from the 6th of April to the 9th of May, I was not taking treatment. I ended up having to go back to Mpumalanga clinic at Polinamra Pedi, where I was given my ARVs.
So ngicabanga ukuthi mhlambe Department of Health angasisiza mhlambe when it comes to ama facilities mhlambe achashe ama-gay lesbians mhlambe understand.
Perhaps the department could assist to hire LGBTI community in the facility so that maybe they could understand us better.
Because bayasiceka understand.
Because we are being discriminated and the nurses do not understand us as LGBTI community.
First, I don't think it was understand because what I do believe it's very important to see again to connect understand it. So umuzamo ukuthi okusho ukuthi vele angeke ngisakhona ukuthi ngithathe treatment eTrishati. So kuyomela ukuthi ngikhwele njalo ngiye eMpumalanga ngithathe treatment ngiphinde ngibuye white nemele transporting ekho.
So this pains me because meaning I will not get my treatment in Ritshidze where I'm residing now. Every time I have to use transport money to go back to Polinamra Pedi whilst I don't even have money for transport.
Ilo isicela sami ukuthi bengicela ukuthi Department of Health amana senzele kanjalo ngoba manje ngizobhlungu ukuthi I get this disease from the rape and then when I came to a clinic ngoba reportela bangitshela ukuthi angeke ulalwe nenye indoda unamanga. So now I try to ukuthi impilo yami ibe right but still they decline ukuthi banginikeze treatment ngiqhubeke impilo yami so angazi simele ngenze njani.
This is hurting me most because I got infected through rape and now I'm trying all my best to adhere to my treatment so that I live a healthy life. But this is the treatment that I get from the clinic.
Ngiyabonga.
Thank you.
Sanibonani.
Greetings.
Ngi-transgender ngiphuma eStanderton.
I'm transgender. I'm from Standerton.
Ngikile ngaya eStanderton Hospital.
I once went to Standerton Hospital.
Ngiyocela usizo about hormones.
I wanted hormonal therapy.
So ngathola udokotela alright like vele masiya eStanderton Hospital like they have to book for us to Steve Biko Hospital in Pretoria.
So when you go to Standerton Hospital, the treatment is good there because you get booked to go to Steve Biko Hospital.
So as transgenders, we have to attend a counseling first.
So as transgender, before you start hormonal therapy, you need to go through the process of counseling.
So the doctor just referred me to a social worker.
I got referred to a social worker as the process.
Ngathi mangifika ku social worker,
When I arrived at the social worker,
azange ngathola counseling but ngathola ukugcekeka kakhulu.
I did not receive the counseling that was expected, but instead I was discriminated against.
So I was told ukuthi ama transgender are not from South Africa, they are from America because they can afford everything that they want.
I was told that transgenders live in America because they can afford what they want, not in South Africa.
So what should I do is just to go back to the school and study and become wealthy so that I can travel to America
So
to
then-
do transgender.
Then I was told that for me, if I want to be a transgender, I must go back to school, study, and become wealthy so that I can travel to America where I can enjoy being a transgender.
And I was even compared to Somizi.
They also even make comparison to Somizi.
Like she asked, why is Somizi not do a transgender because he's wealthy and he has money that no one has.
The nurse also continued to say, why is Somizi not transforming?
Why not Somizi can transition? Yes.
Why is
Because
Somizi
he's
not
wealthy.
transitioning because he's wealthy?
So I just asked her, what is the meaning of LGBTIQ+.
Then I asked the nurse to explain the meaning of LGBTQI+.
Then there was no answer. And then I told her that LGBTI, L is for lesbians.
And then I explained to the nurse what the LGBTIQA stand for.
G is for gays, and then T is for transgender, and I'm a transgender woman, and Somizi is gay.
And then
So-
I explained the L and the G and the T to the nurse and the difference between myself and Somizi, to say Somizi is gay and I'm trans.
So like bengicela ukuthi ka health bangasiza because siyayazi medication okumele siyisebenzise.
My request is that for the Department of Health to assist us because we do know the medication that we need to use.
The only thing that we want
Lento esifunayo
is to replace a hormone, to become women, the women that are living in our body.
siyayazi i-medication ekufuna siyithathe ukuthi si transite to abafazi.
Asikaze salala kwathiwa ngivuke ekseni ngithi manje mina sengi-transgender.
It's not an overnight thing for one to transition.
So siyahlukumezeka kakhulu because ungumfazi ngaphakathi, then bese mawugeza you can't see that woman.
We go through a lot because when you are taking a bath, you cannot see the woman in you.
So bengicela ukuthi ka health like masithola ama prescription to abodokotela abo sister bamane basinikeze leyo medication without asking us ukuthi why should we change ourselves.
Our request is that as we get prescriptions from the doctors, can the nurses just give us the medication without asking us the question as to why we want to change our sexuality?
As sine seed of hope like masinbiza ka health anizi and then bese masize ema clinic nasjaja and masinbiza ukuthi sizonifundisa ngama trans akekho noyedwa ovelayo kodwa ne khona kusigceka.
So as an organization called Seed of Hope, we do call the nurses from the Department of Health to come and educate them about the LGBTI communities, but they never come. The reason why we want to educate them is that they should be informed, but instead when we go to the clinic, we get judged.
Singama-trans like ngicela ukudlulisa lokho
Can I pass this as a trust
kumzali or to anyone.
to a parent or anyone in the room?
Ngicela i-support yenu.
We're requesting your support.
Even nasemasontweni like they say we play God.
Even at churches, they say we play God.
I believe that God is art. Bengeke size siba ama-trans if it wasn't of him. We were born this way.
Thank you.
Thank you very much. You know, this key set of this part, it always so touching because of the level of human rights violation that is happening. And what hurts most is that it's happening in a space where it shouldn't be happening. I always struggle to understand, to say, as a person, why do you want to be understood as you are, but you cannot understand another person? You want to be accepted as you are. If uneshwap, ufuna ukuthanda kuneshwap. If uneyibunu, ufuna ukuthanda kuneyibunu. If uyindoda etshebile, ufuna ukuthanda kutshebile or uslender. But when somebody needs to be treated like that, you can't do that. Who are you to judge? Who are you to say, I will pray for you, keep demon? While we have a constitution that is very beautiful in our country, that guides us clearly how to survive, how to live together. Section 15 of our constitution in the Bill of Rights, it says everyone has a right to freedom of religion and belief. If I come to the clinic wearing my ubuhlali or whatever, no one has a right to tell me that I have demons. If I'm a gay, you don't know what I feel. You don't know what made me to be gay. You don't know what happened into my life. You don't know what is happening within my life. Who are you to come and say, I will do this for you. You can't be this. You can't be this. Who told you now? Who do you be? Uba nokutshelile ukuthi wena usuppose ukuba usibongile ngale ndlela ufanele ube ngayo. No one. But when you feel like you have a right to tell somebody ukuthi fanele benjani. So this doesn't just go to healthcare workers, but to everyone in the community, to say we need to treat each other fairly, equally, as the Constitution needs requires us to do so. Because if you don't want anything wrong to be done to you, don't do it also to other person. Even the very same Bible that we quote to judge other people, it says so. And the Bible says no one has a right to judge other than God. So if you are a healthcare worker, you are a pastor, you are whoever you are, and you think we are better than God, or you think that because I decided to be a trans, then I'm semi-God, then you must look at yourself. You are judging other people while you have four fingers facing to you to say, what about you? So I become very emotional because that is where human rights violation is happening mostly, especially in the healthcare sector. And the people who are doing this are people who are coming from our families, are coming from our communities, and at the end of the day, we face corrective rapes, we face homosexuality and all those violent crimes that are happening in our community. And when we go to court to charge too much, they are the first ones also to come to say, justice for who, while they are perpetrating rape and violence within our community. So we need to walk the walk And if I don't want it to be done to me, let me not do it to another person. So going to the recommendation, the Department of Health should ensure that all clinical and non-clinical staff, including security guard across public healthcare facilities, are sensitized on provision of key population-friendly services to ensure a welcoming and safe environment for all key populations at all times. Key population must be involved in the implementation of these training modules. They just offered to say they can assist to train nurses and please work with the organizations. Any reports of poor staff attitude, privacy violation, verbal or physical abuse, harassment, or of any being own services being restricted, refused, should be urgently investigated. Okay, it doesn't move now. What's happening? What have I done? Okay. The Department of Health and Welfare should expand the Center of Excellence model to ensure that at least 2 public health facilities per population in Gert Sibande serve as key population designated service delivery centers. A minimum package of service should be made available at these facilities as outlined in the State of Health report. Easy referral and adequate resource, including transport money for transport, must be provided for people to take up these services. PEPFAR must support these facilities with additional staff and resources to provide comprehensive health services to the specific key population being served. Ensure that HIV prevention tools, including lubricant, external and internal condoms, PrEP and PAP, are made easily available at all public health facilities. Make available external and internal condoms as well as lubricants in a range of spaces across the facility. For an example, waiting areas, toilet, gates, pharmacy, consultation rooms, quiet areas of site, so people can freely and easily collect them. Ensure that PrEP is offered to everyone, including key population who are not living with HIV, test negative for HIV, with information shared on its benefits. Ensure no staff member will ever tell key population to use Vaseline or other oil-based lubricants instead of water, silicone-based lubes. And now we are next for issues of infrastructure and cleanliness, which will be led by Comrade Lucky.
Thanks, Chair. The next set of issues are on infrastructure and cleanliness. The country's load shedding crisis negatively impacts the provision of healthcare in our clinics and can often lead to people waiting much longer to collect medicine or consult with a clinician. In Gert Sibande, the most common challenges include delays in finding files when filing rooms are in darkness, and data capturers not being able to capture information, creating a backlog and impacting follow-up with people who have missed appointments and recall systems. Generators at each facility could resolve these challenges, yet some facilities do not have a generator that is working or has fuel. 78% of facilities monitored in Gert Sibande were observed to be in a good condition, up from 56% last year. Of the 22% in bad condition, the most common reason is that the buildings are in need of renovation. 72% of facilities reported needed more space, down from 76 last year, with waiting space, filing space, and rooms for medical care, given as the most common things facilities needed extra space for, impacting negatively on congestion, TB infection control, maintaining organized filing systems and confidentiality. On overall cleanliness, 90% of public healthcare users reported that facilities were very clean, or clean. However, 11% reported that the facilities were very dirty. Well, 69% of Ritshidze observations found that toilets were in bad condition, with no toilet paper and no soap given as the most common reasons. Now we move to recorded stories.
Bese okunye esihlangabezene nakho ngo2021 sasigulelwa ubaba ngalelo shading kuyintambama ngabo 7. Ubaba wathi makafika eclinic wathola inesi licishile angafuni ukusizwa khona lapho phakathi eclinic. Usisi wayehamba nosisi wami kwathola ukuthi kunobhuti amaziyo osebenza ozwana nabo bhuti bama ambulance. Lo bhuti loyo wama ambulance baze bamfonela wafika wazama ukuthi azomupha usizo. Kwakhani lo sesi lo oseclinic ophakathi eclinic sekavula eclinic ngoba ubaba wayedinga oxygen. After lapho azange azamfaka ioxygen bathatha ubaba bamfaka eambulanceni wathola ioxygen kwakhani ahamba ayevenda ayo attenda khona kwakhani athola usizo lapho kodwa egcineni wagcina sekashiye emhlabeni.
So we proceed to recommendation. The Department of Health should ensure that all public health facilities have functional generator with sufficient fuel so that health services and administrative work can continue during load shedding. Ensure that all public healthcare users are consulted, tested, and or counseled in private rooms. Carry out an audit of all facility to assess infrastructural challenges, after which the department should develop a plan in order to renovate buildings and ensure adequate space to provide efficient, private and safe healthcare services. The department must publish the audit results. In the interim, provide temporary structures to ensure that more people living with HIV are being decanted out of the facility and receiving longer referrals to reduce burden and overcrowding in overcrowded clinics. Ensure that all facilities are maintained in a higher standard of cleanliness, including through implementing regular cleaning routines. Ensure clinics resources provide soap, toilet, and toilet paper in all toilets, which I want to congratulate Department of Health of Mpumalanga. You did very well from the report last year. If you look at the report last year, it says 56%. Now you have moved to 78%. Keep up the good work. It means you can be able to reach 100%. And also in terms of the cleanliness, at least you are doing very well when we are saying 90%, when we see 90% of the clinics being cleaned, the 11%, it means just those few clinics which it can 100% you can be able to reach it. So we cannot just come and criticize only, but we need to comment where we are doing well. Thank you very much on that. So without wasting any time, I will give it to Simpiwe for the issues of tuberculosis. And please be patient with us. I know that we've been here for a very long time. I think this is the last set of issues.
Thank you, Chair. The next group of issues, or the last one rather, are on TB infection control. In South Africa, around 300,000 people develop tuberculosis every year, and about 56,000 people die. Yet, TB infection control in our public health facilities remains inadequate. By following a simple checklist of good practice, including key measures that were successfully implemented during COVID-19, facilities can be safer for public healthcare users and staff. With the checklist in mind, Ritshidze has developed a scorecard and a traffic light system to rate clinics on how good their TB infection control is. Clinics that adhere to all measures are given a green light. Those that are on the right track but still off target get a yellow light, and a red light is given to those that are way off the mark on ticking the checklist for the 6 measures. In April and May 2023, 0 facilities were awarded green status for checking all 6 measures on the scorecard. Ritshidze scored 8 clinics yellow status. This translates to 44% of the facilities being monitored, following about half of the best practice measures for infection control. It leaves 10 facilities, or 56% of facilities surveyed, failing altogether at meeting these 6 basic best practices to stop the spread of TB. Do we have community stories? Oh, okay. We will now move on to the recommendations.
Okay, thank you. And then the recommendations are the Department of Health should issue communication to all facilities stating that all windows must be kept open, TB infection control posters must be displayed in a visible place in the waiting area. Public healthcare users must be screened for TB symptoms upon arrival. People coughing or with TB symptoms must be seen first to reduce the risk of transmission. People coughing or with TB symptoms must be provided with mask. People who are coughing must be separated from those who are not while waiting. Carry out a full audit of all public health facilities in the province to assess TB infection control based upon WHO guidelines, after which the department should develop a plan based upon the infrastructural, human resource or behavioral change found in order to improve TB infection control. The department must publish the audit results. So we are at the end of our presentations. Oh no, we are, okay. I thought we are not. Oh, okay. So we are at the end of our presentations, and I would like to thank everyone who participated, telling your stories about how is your experience in facilities. You know, sometimes they say, "Ingcono mayikhulunywa ngumniniyo than I relate a story to another person," because when I tell your story, I won't tell it as you were going to tell it. So I hope also those who were identified to be assisted, Mpumalanga comrades will make sure, comrade like he was writing here, comrade Sihle, I know she's busy, but they'll be working together. But without wasting more time, colleagues, I would like to call for our partners just for a few messages of support. I'll be very strict because I know some of them, they talk too much, especially those from the coalition of people living with HIV. I will start with Mapaseka, Moik and Maspaseka. Don't belong, my comrade. Nyana has niteta too much.
Sanibonani colleagues, ninjani? Ngiyaphila, igama lami mina ngimapaseka ngakamthiyari Sibongo. I'm a member of Positive Women's Network, PWN. Tina as PWN into esiyenzayo simonithara ama-issues ababhekelele nabantu besifazane kakhulu. Umsebenzi wethu logo, so sitholakala kuma-facilities like almost of the time. Surprisingly, so izolo bengise Bethel Town Clinic. Bekunomama about una futhi akusumama teenager una 18 years. On Tuesday uteste efieldini. Bamthatha la bamteste Tuesday efieldini bamnikisa eBethel Town Clinic for care and treatment. Nawafika ekliniki mention issue ukuthi ngo-August uzo-relocate aye eVerini. Right there bavele bamnikeza i-referral. No medication, no nothing. Nabafika kithi ba-reporta ukuthi usisters utestile bamnikeze i-referral without medication. Ngamthatha mina yesterday ngamnikisa e-town clinic. Uthethe umntwana emhlanje on Tuesday nakafika ekliniki. Ekliniki babona ukuthi umntwana akekho right bamnikeze iPanado bamnikeza nomdogo only. Thina izolo nasesibabisela the question engiyibuzile ukuthi umama umntwana uteste positive on Tuesday weze clinic umntwana yena nimcheckile nabona ukuthi udinga iPanado nomdogo only bathi abo sister sicabanga ukuthi une malnutrition nenzeni ngalokho nothing. Izolo mina nang-addressa le issue kuthiwa mina I was being rude bengine-attitude only because nangiceda kureport le issue angihambanga ekliniki ngihlalile the whole day to oversee ukuthi bayamsiza yini ugirl nomntwana. For that ngireporte kuyi-director yami ukuthi mina ngine-attitude ngidelela amanesi nangifika ekliniki. It's not an issue, it's fine, kulungile. If kuloko kumele sikwenze ukuze izinto zibe right, it's fine, it's okay. Bamsizile usister bamnikeza i-referral eya e-Bethel Hospital. Umntwana uzo-attenda lapho, a 18-month child HIV positive in 2023. Asikho lapho kulungile. I-Department of Health ngiyacabanga ukuthi inayo solution for that. It's a pity lo mntwana una 18 months. But abakwazanga on Tuesday babona ukuthi lo mntwana kune problem bamnika iPanado. Siyazi ukuthi wonke umuntu ongena ekliniki iPanado is the best. Uphethwe ikhanda, uphethwe ubhonzo ne-STI iPanado. It's okay. Esiyadi sibene problem notholwe ngago bathi imidogo i-expire. Nasibuza ukuthi imidogo i-expire kanjani bathi umphathi uyakhiya uhamba nekhiya. Uma ngabe uzo request umdogo uzoya ku interview nomphathi uyochaza ukuthi why udinga umdogo, for who and why. Again ngama Friday kunabantu abafaka i-implant every Friday. There was a time la kwathiwa khona abajike. Ngibuze mina bajikelani ama appointment wabo siyawa reschedule ukuthi umphathi ukhile. Uhambe nesikhiya and uku-sick leave akabambi nefoni. Isiya clinic yamphathi noma yomphakathi na. Uma ngabe umphathi ahamba kanti ayikho second in charge ukuthi izintambo zonke yonke into ishiwe ku second in charge. Sinenkinga enkulu kakhulu Department of Health. E-town clinic kune mobile ngaphandle na ungena egedini kuhlala ama-nurse or ama-lay counselor we-Broadridge. Ngaphakathi e-clinic kune room 6 nalapho kuyatestwa. Uma ngabe i-client ingaphakathi kuthiwa hamba testa imikiswa e-room 6. Na ifika e-room 6 bathi laba batestayo hamba ku-mobile ngaphandle. Na afika ku-mobile bayambuza bathi ubuya phi uthi phakathi. So why ungatestanga laba ngaphakathi bathi angiphumele ngaphandle. Only to find out ukuthi kune beef between laba batesta ngaphakathi nalaba be-mobile. So ama-client mele asendwe from birth to fourth ngenxa yokuthi kune-staff esingazwani. Siyacela Department of Health asikakafuni kuye emgwaqweni. Asilungiseni kuma-boardrooms. Ngiyabonga.
Siyabonga my leader. That's it why ngisaba ukunikeza ispace. Ngikhuluma too much. Ngiyadlala. Okay, with now I would like to call Comrade Sifiso Nkangala ngizokukhathani. Nyaba nyakwazi nawe ngomunye nje.
Sanibona. Usifiso waKankala. Ngiphuma ku Treatment Action Campaign, which is a social movement in a character Marxist character the way engakhona. Yeah. So these are issues that which we face every day. We as the Sabane training for a department, okay, you are part of it, Uspindile, Usapumile. And we have a very good relationship at the district level, but when you go down to the facilities, kune challenge, kakhulu. And okubuhlungu indaba zama 6 core standards, staff attitude. Lesi esikhuluma ngaso la, sivele sibalwe kakhulu. Number 2 is this issue, yama long waiting times, lawa tekhulunywa ngawo la. We know about it. That is the reason why we had to have we had to have training last year. It was October, Kate, and it. That training, the first training was funded by us, Comrade Sibongile. We trained, and then it was decentralized to every facility in order to ensure that we kept or we flattened this thing. Inking ayama missing patient files. It's also one of the issues that which we see every day, and we did discuss it. And that's also one of our issues ezenza ukuthi, which forced us ukuthi sibe nalama trainings as that we said we want to have nama facility managers. Shortages and stockouts of medicines. I last talked to Brian. Now nama issues ama pregnancy test ukuthi abantu abambe bayoyithengela what wangitshelile vele ukuthi kwenzakala ini amanye aphindiselwe emuva. They turned back some of ama pregnancy test, ama Implanon and all that, and wangitshela ukuthi they want ukuthi batshintshelwe. Wangitshela uBrian ukuthi they want them to be changed by a supplier to give them the correct ones and all that. We had a discussion on that one. And ne issue yabantu okumele ukuthi bambe bayothenga imithi. You are at the Clear facility because it needs to be free. It's a free service, but they give you prescription to go and buy. We know about such things. And that's what makes us to be in communication, long communication with the pharmacist at DEP regarding such issues. And I'm happy noguti ukona nawe Mam Kumal. You know about such issues, Mam Kate, I'm sure you know about it. And in the it's that we also have what we call the National Health Act. If you go to chapter 2, the National Health Act, I gave each department about 40 copies a few years back. If you go to chapter 2, it talks about user to have full knowledge. Ngikhuluma ngalo othe bamsika specimen or a sample wangazi ukuthi kwenzakala ini. That's one this is the booklet. I do have them. If you want more copies, because I did give it district more copies of this. This is the act. Eksiyo ingondo kasfiso noma ka comrade usibongile noma ubani noma we Ritshidze. You need to have full knowledge regarding isifo esikuphethe nokuthi kwenzakala ini ngomzimba wakho. You need to consent ukuthi bakhiphe leso sicupsi leso ngichaza ukuthi that sample le kade ekhuluma ngayo usis but it looks as if it doesn't happen. And also participate in decision making. It's here. It's not me who's saying such a thing. It's here in the National Health Act. Participate as a patient in decision making regarding your personal health at every level. But we don't participate. And this is an issue again. Yeah. Yeah, but it makes me feel so bad. It makes me feel, yabona ingenza ngazuthi kukhona something esingalwenzi. We are always trying, njoba ngisho ngithi, I'll repeat again. We have a very great relationship with the district. But when it goes down to the facilities, it's very bad. And it's like, now we have to go to court and sue a department based in negligence or either any other things, because this is the act. But we work, siyenza siyayiphambanisa what is written here. And I don't enjoy it. And I feel being failed. Whereas we do spend our money as tech. As I say, we training here last year, we did foot the bill, Tina Ngogwet as tech, in order to train everyone, and it was decentralized. And I'm not happy about that.
Don't be too angry,
Sure.
Fiso. Department of Health at the district level, as you say that there is a good relationship, then you need to go back to the table and see how do you cascade this information down.
Yeah, one last thing.
Yehlisa umoya,
One
yehlisa
One last thing is the issue of NHI. Izophumelela kanjani uma ngabe kunale nkinga? Sikhuluma nge-universal health coverage.
Yeah.
Isayiniwe as a bill, but the problem is one. How are we going to enjoy access to healthcare services if we've got these problems, these challenges? Njengamanje.
Amen.
Siyapi.
Amen. Thank you, Comrade Fiso. Unfortunately, I won't allow any hands, ne? Because we've been taking so much long. Askisin, I'm going to now call Comrade Vangile Mashinini. Are you still here? Oh, yes, Madali. I wanna wakboko kwa mingzalwa ukoko zalubabu na mashinini. Wagi timpele.
Sanibonani.
Yeah.
Kahle kahle ngifuna ukusho ku Department of Health ukuthi kuzo zonke lenkinga ezikhulunywe la ngaphambili nathi siyazazi ama challenge esidibana nawo endleleni. Ngiyacabanga ukuthi department njengoba ala uzokwazi ukuthi kule nkinga ezikhulunyiwe bese uyazama ukuthi ezinye uyazilungisa. Kakhulu engilwa nayo ile waiting period esiyimayo. Nalokuthi uma sifike ekliniki sima ngaphandle egate ikliniki ivulwa ngo7 but thina sizongena ngo7:15 umuntu nakafika azovula ekliniki. Ngiyacela ukuthi iDepartment of Health ibhekelele leyo ndaba leyo. Asingeni ngaphakathi noma imvula ina kusho ukuthi kosa sime uzama iplan lokuthi uyisithe ukuthi unganethwe. Ngiyacela kuleyo ndawo leyo ukuthi abasibonelele indlela yokuthi sithole mhlambe indawo yokuthi singayifihla. Ngiyacela futhi okunye ukuthi kulabantu abatransferwayo ukuthi mabaye mhlambe esibhedlela. Akube khona itransport ezobathatha ngoba abanayo imali yokuthi bangagibela bahambe baye esibhedlela kodwa bayagula bayalidinga usizo. Ngiyacela futhi ukuthi kulama phakathi atholakala ekliniki kunabantu abangakutholi ukudla vele uma umuntu athi uyaya bathi hayi wena umzimba wakho mkhulu lokudla kutholwa abantu abangana weight. Ngiyacela naloko ukuthi ababhekelele mhlambe ukuthi isimo sinjani ekhaya ukuze naye akhona ukuphuza amaphilisi. Ngiyacabanga ukuthi department izwile. Ngiyabonga.
Siyabonga namashinini siyabonga. Ngicela ukuxolisa for Pastor Patrick Villane. He was here with us, but because of other commitments from Sanarela, he had to attend to those commitments. So without wasting any time, I will give also to Peggy Khoza for reflections. Peggy nyakwazi nobu comrade wena. Ube few ube kahle kancane ube zikindi.
Afternoon, colleagues. No, I'm not going to say comrades because associate and I'm a comrade. I'm not. Afternoon, colleagues. I don't know whether I should start by acknowledging the report and committing Broadreach into responding to some of the issues that you have raised. I think we were privileged to attend the leg of this community reporting here at Ehlanzeni. So we had enough time to go through your report as Broadreach, and we've seen some of your recommendations. But what I would like to forward to Ritshidze, that name. You've raised a lot of issues, and some of these issues are affecting the key population. Can I request that in the near future, you also consider inviting partners that are supporting the department on ensuring that key POPs are taken care of in facilities? They've spoken of ANOVA, they've spoken of the Seed of Hope and your TB-HIV care. I think what we need also to advance to the community and the key population is that these partners are not operating in isolation. Whatever service they are providing you, they are providing you on behalf of the department. But what it's important for us as partners or as Broadreach, I will put it to lead a program in Mpumalanga and Putlaki. Colleagues, some of these issues are issues that we should have resolved about 3 months ago. Some of these issues are issues that we can resolve within 24 hours. Ulaki, we had meetings with him several times requesting that issues that are pressing, don't wait for this platform. Please reach out to us immediately so that we can sort them out. And I'm appealing to you as the leaders again to say, please reach out to us immediately with certain issues that you feel that are pressing and they must be resolved immediately. As Broadreach, we are ready. I'm only a phone call away, I'm only a WhatsApp away. I even answer my call around 1 o'clock, like Imagang Fonela, he knows, as long as it is work-related. But also to try and address the issue of e-waiting time in Matliniki. As Broadridge, in support of the department, we have filing intents in most of the facilities. In Governimpeg alone, because you've been complaining about the waiting time at Governimpeg, we have about 16 young people who are under the age of 25 that we've put on a contract of a year to do only file pulling for our clients that are coming. And they even pre-pull the files a day before you come. So if they go through the system and they realize that you're supposed to come tomorrow, they will pre-pull the files today so that tomorrow when you come, you don't wait for a long time. And it is not only Governimpeg, we have them across the district. I can't count per facility, but I know that there's no facility that has less than 2 of those filing intents across. And we have close to 300 data capturers. If people feel that our results are not captured or anything, Broadridge has 300 data capturers across the district and professional nurses that we have deployed to support the department, apart from the human resource that the department is forwarding to facilities. So as a DSP, we are here to respond. We are here to work with you. We are here to make your lives easier. So please, colleagues, work with us so that we can work with you and make your life easier. And ngiyabonga.
Siyabonga.
Lucky unganyamalali. Anganyamalali, please.
Ngizomholda accountable.
Please, because nguye lo nyamalele. Some of these issues.
Phezu kwakhe. Phezu kwakhe. Ngizodila naye ungawari. I'm not sure, leaders, if there is somebody from the district who would like to just respond. I'm not going to pick anyone, you know yourselves.
Good morning or good afternoon. Yes, I have heard all the concerns and we have also heard the report. But what I'm asking to our community is that when you enter the clinic or the facility and you don't find any joy, there are some operational managers that you can go. And on the walls, they do put their contact numbers. They also do put where to find them. Please, if they don't give you the medication or whatever that you need at the facility, do not go home being unattended. Get the operational manager, sit down with her or him, and relate your concerns. Because as the Department of Health, we are saying we have to give you the services. And when you've got the issue where you are supposed to go and they've given you the appointment date, let us try by all means to abide to the appointment dates. And I'm still saying to you, if you don't get any joy, even though you've got an appointment date for that particular day, please do not hold it inside you or within yourself. Because things that we hold within ourselves, they really kill us. Let us not wait until after 3 months that we come here and we are able to issue or say our concerns. And for our partners, if the community also give you some concerns, do not wait a long time. Let the concerns reach the district so that they're able to be resolved in time. And by so saying, I've got a person that can add there and there. So we have noted and we are acknowledging what we are saying. I'm young, I will take it to my seniors, all the concerns that we are having. And I will also ask somehow our friends or colleague that they organize a day where they can come to the district and be able to present to all the district. But things that you have indicated, I will also indicate to them. I'm also having the PHC supervisors amongst ourselves. Then when they do have their meetings, they were taking some notes and they will be able to address all the issues because we've got different sub-districts. So they will be able to communicate with the operational managers at their different sub-districts. I thank you.
Siyabonga.
Thank you. Sanbonan.
Yeah.
Ninjani?
Siyaphila kunjani?
Siyaphila. Mina I am Spindile Mvelase. I am the training coordinator for the district. So I'm going to respond on the very sensitive issue of key populations. I've read the recommendations here. Fortunately, as the Department of Health, Gert Sibande district, we've started with most of the recommendations here. For example, we've identified 2 of our facilities as centers of excellence. Ehlanzeni is one of them, and here in Sugaligwa and Dakakral, CHC in Pixlikaseme. So those are our 2 centers of excellence for our key populations. So, and we have started with trainings. We're training everyone in the facility. We got a mandate to train 95% of the people in the facility, from the security to the nurse to the doctor in the facilities. But as the district, we said, we're not going to train 95%, but we're going to go for 100% in these 2 facilities. We have started, and we are saying when we are training, we don't train key pop without key population. We cannot do it without them. So every time, because we go to these facilities to train, every time when we go there, we go with a member of a key population. Like today, my team was at Dakakral training there, and they went with one of the members of the Seed of Hope. So Upen is there. Upen is a trans woman, so she's there. You know, they are training. She's talking about things that she knows. So it's very easy and interesting because we work together as a team with the Seed of Hope, Inova, and Broadridge. By the way, thank you very much for Broadridge, because Broadridge, they've got a dreams and keep up section. So work together with that section. When you go to train in these facilities, we go with them because we cannot do trainings without them. Yes. And secondly, Umpati was Nkangala is here. And there were some concerns about Nkangala. They're not treating key populations well when they go there. But they said 2 years ago, 2 years ago. Now we've started with training. I'm sure when you go there, you're going to find a different picture from 2 years ago. Because now they've been trained, they know what they're doing, and Mpatwakon is very supportive. She's here. And thank you very much, and thank you for being here.
Siyabonga. I'm not sure. Please pardon me. Is there any official from the provincial health, so that I don't miss anyone? No one. Okay. On that note, let me thank everyone for being. You want to say something? Okay. Can we give you a mic stand or something? Yes.
Peggy, my number. As Umpati was saying, our numbers are in all the clinics, but it's fine because Uputu bekasashoti uphuma lapha so ukudidekile so ungasabuki nasemabondeni ubuka ukuthi ngathinta abantu mangasizakala. Ngicela unikeze inamba yami 081 584 9059. Mawungiwhatsappele nje washo ukuthi Mama Silela nguzibani angiphatheki kahle kuphi kuphi ngizokhona uku-assista. Thank you very much.
Siyabonga Mama Silela, sibonga kakhulu. And I can attest to what you're saying. I'm from Gauteng. There's one district manager that I always talk to. When there is a problem, and I say, Tate Makoro, there's a problem here, now, he will say, I'll be up to it. Follow it up. Within a short space of time, it's sorted. As Uputbeg was saying, let's talk about these issues as they happen so that we deal with them. And it makes lives easier for everyone. And everyone, those who are supposed to be held accountable are held accountable at that time. So we will be able to solve our problems if we continue to work together. I like your courage. Thank you very much, Mama Silela. Continue to be the leader that you are. Not to say others are not leaders because they didn't issue their numbers. Okay, thank you very much, colleagues. And unfortunately, my sweetheart, ngiyavala manje ezinye sozixoxa ngaphandle. Ngicela ukuthi those who want to be assisted, maybe one-on-one, the leadership from the Department of Health, as Gert Sibande, they are here. Here is Lucky, here is Simpiwe, and our colleagues also who are wearing HIV positive and Ritshidze, regalia. We are happy to assist. So I think my job ends here. I'll hand over to Simpiwe with the last logistics. I don't know anything about water, food.
All right, thank you. Thank you so much for everyone, for your time, for being patient since today, since the morning. So for food, comrades can just walk inside the hall after we are done, and then food will be served there for everyone. And then as Chairperson has alluded,